Hello everyone, very good evening to all of you. Am I clearly visible, audible? First you have to confirm in the comment box if I'm clearly visible, audible, everything is good to go. We can start the session ahead. Can we start? I'm waiting for your comments. Is it okay? Everything is good to go? Thank you for confirmation. Thank you so much for confirmation. So very good evening to all of you. Those who are attending my session for the first time and don't know me, let me introduce myself. I am Dr. Priyanka Sachdev here. And today, I will be taking the demo session for third Prof Buster 1.0. The subject today is community medicine. So I welcome you all for today's session and let's start it. Let's start today's session. So most of the students who are attending the session today, I guess they must be third Prof students as it is third Prof Buster 1.0 demo. So before coming on today's demo, today's topic, that is epidemiology in one shot, I would like to introduce the struggles, the problems which are usually faced by the third Prof students. We will quickly, in next few minutes, I will just summarize the struggles. Okay, so there are three types of struggles as you can see. Let me come on the academic struggles. First of all, there are 4 subjects in the third Prof. I mean, some universities have 4 subjects, some universities have 2 subjects, PSM, forensic medicine, ENT and opthal. All these 4 subjects demand equal attention. But you know, the learning style of all these 4 subjects is totally different. That is the biggest problem which is faced by third Prof students, I feel so. Okay. The second problem, difficulty in applying the theory clinically. Okay, most of the students feel difficulty in applying the theory clinically. I mean, they understand on paper but become blank in the viva. Okay, so this is the second problem which is faced by the students. The third is lack of revision structure. Students start with one subject, they forget another halfway through. Do you also feel so? This is your problem, yes or no? The next is fear of viva and spotters, especially when the simple questions are little bit twisted by the examiners. Students get confused in the viva and spotters in the university exams. The next type of struggles or problems is curriculum and NMC guidelines. Now, sometimes in some university, ENT opthal is included in third Prof. In some universities, it is included in fourth Prof. And it always creates confusion at the back of the mind in the students. Yes or no? So in your university, is it included in third Prof or final Prof? So it always creates confusion in the student as much as I have talked to the students and I know. Okay, but remember one thing, order doesn't matter. What matters is the mastery in those subjects. Now, whether ENT opthal are in third Prof or in final Prof, it doesn't matter. What matters most is you should know them with clarity and confidence. Yes, and better is to early start and early finish them. The next type of problems is time and energy struggle. Yes or no? Most of the students are juggling with too many responsibilities like community posting, ward posting, lectures, practicals, and they're still trying to find some time in the library for self-study. Yes or no? I guess this is the biggest problem most of the students face. Yes or no? And never-ending cycles of internals, seminars, and submissions. So that's why students don't find time for doing self-study and complete the syllabus on the time. Now, let me tell you the bigger picture. We have enumerated the problems. Now, let me tell you the bigger picture of the third Prof. Why third Prof matters most. Why it is most important Prof. Now, let me remind you, in the final Prof, you have 9 to 10 subjects, depending from university to university. You have 9 to 10 subjects in the final Prof. So if you are finishing your third Prof on time, you will start your final Prof subjects on time. And maybe some final Prof subjects you will finish in third Prof itself and it will be better for you. Yes or no? So if you are completing these 4 subjects timely over here, you will get time for your major subjects of the final year. That's why this Prof, the third Prof, is very important. And starting from the beginning and finish it quickly earlier is very important. Yes or no? Do you feel so? So by looking at all these problems of the students, okay, so the team we thought to launch the groundbreaking course, that is third Prof Buster 1.0. So we are launching this course today, in which I, Dr. Priyanka, I will cover all 4 subjects. Okay, I will teach you community medicine, FMT, ENT and ophthalmology. All these 4 subjects will be taught by me. I will take daily 2 to 3 hour live session. It is not daily, it is 2:1. 2-day lecture, 1-day break. 2-day lecture, 1-day break. Like it is 2:1 schedule. I guess the detailed schedule is already provided to you if you have inquired on the support number. Yes, so it is 2:1. And the entire session, entire syllabus will be covered in 4 months. The sessions will be in the evening only so that you can attend them live. Okay, and the entire syllabus of all 4 subjects will be completed in 4 months. The live sessions will be completed in 4 months, but the recordings of them will be accessible for 1 year from the date of the purchase. Okay, and for ENT Opthal, it will be available for 2 years, because in some universities, ENT and ophthalmology is in final year. So you can revise them later on after 2 years also. So start date is today. Today we are starting this course, and the end date will be 22 February. For detailed brochure, you can ask on the support number. So you can see the complete schedule, you can see the color coding of the 4 subjects, and you can see the complete schedule. We are starting today and we will end it successfully on 22nd of February. So this is the complete schedule of Prof Buster, third Prof Buster 1.0. Here in this course, I will provide you daily live interactive sessions, teaching with 3D models in the clinical subjects, that is ENT and ophthalmology. I will teach you both these subjects with 3D models. I will show you all the layers of the eye one by one by opening them. I'm having the 3D models with me. Okay, and recordings of these live sessions will be available. Digital notes, printable notes, that is the new things we are introducing this session. And annotated notes, all type of notes will be available for you. Quiz, question bank, all type of question bank, university exam question bank, and competitive exam, NEET, PG, INICT question bank will be available. And practical library. Now let me clarify. Many students have asked, is this course particularly for university exam or NEET, PG, INICT? It is for both. I will teach you all the topics in detailed, comprehensive way. Now after that, you can write the long question, short question also, and excel and get distinction in your university exam. And you can try any MCQ, any PYQ of any platform. Take my challenge. By watching only my session in this course, you can crack all the MCQs. So this course is for both, for university exams as well as for competitive exam preparation for these 4 subjects. Got it? So that is the inclusion in this course. You can see I will take total 87 live sessions. If something is pending in these, that will be recording will be provided. But 87 live sessions are there. Okay. And today is the first demo. So today we are starting with community medicine. The topic for today is epidemiology in one shot. Okay. So let me come on this topic. But this is not the last demo. We are having total 8 demo. So please stay connected for me with the next for the next 8 days. And you see how I will simplify the things, and it will be worth watching each and every lecture. Okay, so 2 sessions on each subject will be as demo, and you can see the topics are most important topics in all these 4 subjects. So that is about the demo. For any further details, you can WhatsApp on this number. Okay, so let's start. Let's start it. Can I start the topic for today? Community medicine, epidemiology in one shot. Can we start it? Are you people ready? How many of you are ready with me? Give me a minute. Can we start? Now I can see many students are doing inquiry about the course. For any further details regarding the course, just a second. For any further details regarding the course, you can WhatsApp on that number. So without wasting any further time, we should start the topic now. The demo topic today, that is epidemiology, community medicine, the most important topic in community medicine. You get many MCQs on this topic, and this is further very important topic for your university exams also. Can I start it? So let's start epidemiology. The notes of this topic is already available in the comment box. You can see the pinned message in the comment box, and you can go and you will get the notes. Okay, the PDF is available. So notes are already available. You can take a printout later on. Can we start? So let's start epidemiology. Before coming on the bookish definition of epidemiology, that is boring, you won't understand it directly. So let me explain you in simple words. What's epidemiology? Let me explain you in very simple words. What's epidemiology? Okay, before I teach you what's epidemiology, what is the definition of epidemiology, you tell me, have you ever wondered why some diseases disappear while others explode into pandemic? Some diseases disappear, totally disappear, while others explode into pandemic. Have you ever thought? And that's the story epidemiology tells us. So here is the question that should arise in your mind before studying epidemiology. Okay, so what is epidemiology? It's a science that protects the people before it treats. It's a preventive science that is protecting the people before it treats. It's a very important branch of medicine. So it's a science where math meets the medicine. It's a science, where number have a purpose. Okay, we will solve many numericals also today. So I will come on the numericals, but here the numbers are with a purpose. Okay, now behind every public health success lies the role of a detective, and that's the true detective, that is the epidemiologist. Who, you know what is the epidemiologist? I mean, who is the epidemiologist? How epidemiologist differs from the clinician? Who is the clinician? Who is the epidemiologist? How they differ? Do you know that? Yes or no? Clinicians save one life at a time. Yes or no? But epidemiologists save communities before even they fall sick. Before even they are healthy, before even they fall sick, they save the communities. That is epidemiologist. This is the difference between clinician and epidemiologist. Or else you can say clinician fight the disease inside the wards, while the epidemiologist fights the disease before it enters the wards. Okay, and that's the real preventive power. So can we say medicine treat one patient, but epidemiology protects millions of people. So with this understanding, now you will understand what is epidemiology. Now, frankly, you tell me, how many of you feel that epidemiology is a very dry, boring, monotonous topic? Tell me in the comment box. How many of you feel so? Do you feel so? It's a very boring topic. It's very boring, monotonous, dry topic. Yes or no? So trust my words. You attend my session just for next 2 hours. Okay, you be with me for the next 2 hours. You will see diseases like Sherlock Holmes sees the clues. Believe my words. Okay, just be with me for the next 2 hours and it will be worth watching. Okay, so let's start the topic now. You understood the introductory part. Okay, now let's start the topic. So what is the bookish language, bookish definition of epidemiology? So the definition of epidemiology is given by John Amlast, the greatest epidemiologist and a very expert public health expert. Okay, that is John Amlast. You have to write this definition in your exam that I'm going to tell you now. You don't have to write all these definitions which I taught you. This is just for your understanding I taught you. Okay, this one, you don't have to write. This is for your understanding. But what definition you have to write in your exam, or you have to, take in your MCQs, that is the given by John Amlast, the greatest epidemiologist, you can see. So this is the definition. You have to learn this definition word by word. Okay, so you don't have to mug it up. Now you will understand it because you have, your concept clear. So what is epidemiology? It's a study. Obviously, it's a study of what? It's a study of health-related events in a specific population, not in complete population of the world, not in complete population of the country. No, in a specific population. So we are selecting a specific population. We have selected a specific population. Now in this specific population, we are studying the health-related events. It can be a disease, it can be any event, it can be death. It is health-related events. So study of what? Study of, learn it, study of health-related events. In whom? In whom? In a specific population. So health-related events, what we have to study about the health-related events? We have to study their distribution and determinants. So we have to study their D&D. So we have to study distribution and the determinants of health-related events in a specific population. Not only this, after studying, we have to apply this knowledge in controlling the disease. We don't have to just study that. Study kiya, chhod diya. No, but we are studying and leaving it. No, we have to study and apply that knowledge in controlling the disease. So now try to, figure it out, the definition. Say the definition with me. The definition of epidemiology. What's the definition of epidemiology? It's the study. Study of what? It's a study of health-related events in a specific population. From the total population, I am taking a specific population. In this specific population, I am studying health-related events. I am studying the distribution and determinants of health-related events in a specific population, and I'm applying that knowledge in controlling the disease. That is the definition of epidemiology. Now, if you have understood it, you can reframe in your own words. Okay, so that is the definition given by John Amlast that you have to write in your exam. Now, before coming on epidemiology studies, okay, before coming on epidemiological studies, I will teach you all studies in detail: case control, cohort, cross-sectional, randomized controlled trial. We will see descriptive studies. We will see them, all of them, one by one, but not now. I will come on this topic later on. Before that, you have to understand the tools of measurement in epidemiology. Otherwise, you can't understand these studies. So we have to go step by step. We can't directly jump on the studies. No, that's not my way of teaching. So first we have to understand the tools of measurement in epidemiology. Okay. Those who are asking any doubts now, I will address, I can see in the comments, but in the flow of teaching, it's difficult for me to halt in middle and address your doubts. So those who are asking the doubts related to this topic, let me finish this, this particular topic and then I will address your doubts. Okay, chalo, come on. So let me come on the tools of measurement in epidemiology. There are three tools of measurement in epidemiology. We will quickly see them: rate, ratio, and proportion. First, we have to understand what is rate, what is ratio, and what is proportion. We have already seen them in mathematics, I guess in your 7th or 8th standard, but we will revise them today. Okay, so quickly we will revise what is rate, what is ratio, what is proportion, and then we will come on the studies. Okay, so in all of them, rate as well as ratio as well as proportion, in all of them, there is a numerator, there is a denominator, there is a time specifier, and there is a multiplier. Now, based on the differences between them, I will tell you the definition of rate, ratio, proportion. It's very easy. You just focus for 2 minutes. Okay, what is rate? Let's start them one by one. What is rate? What is rate? Rate is occurrence of some particular event during a given time, okay, in a particular population. Okay, you don't mug up this definition. If you try to mug up the definition, you will get confused. Okay, try to see the formula. You will understand formulas better and then reframe the definition in exam in your own words. Okay, got it? Now, for example, death rate is a rate. It's a type of rate. What I'm teaching you rate. There are three tools in measurement: rate, ratio, proportion. So I'm teaching you the first one. The first one is the rate. Yes. So what is rate? Death rate is a type of rate. So what's the formula? You have a look on the formula. In the denominator, we are having midyear population, the total population of the country, midyear population of India, for example. Okay, so the denominator having population, total population, midyear population or total population. The numerator is number of death from that population. Okay, the people who are dying are from the population only. Obviously, they are not aliens. Okay, the people who are dying over here, okay, they are from the population only. So can I say the numerator is a part of denominator? Denominator include total people. Okay, let's say this is 2025 going on right now, the year. Okay, last year 2024 is already passed, obviously. So in 2024, what is the death rate of India? What is the death rate of India in 2024? So you say, ki ma'am, what was the midyear population in 2024? You say that in denominator. From that, how many people died in 2024? From 1st January till 31st December. How many people are died? Huh? That will be the numerator. Okay, so numerator is a part of denominator. The people who are dying are from population only. They are from not some other planet. They are from the population only. So numerator is a part of denominator. In 1 year, we can say 2024, 2023, 22, any year that has passed. We cannot calculate for 2025 because it's going on. Okay, so any year. So there is a time specifier and the multiplier is 1000. Usually 1000. It can be 10,000, it can be 1 lakh, it can be 10 lakh. Okay, it can be anything but not 100. The multiplier can never be 100 in rate. Rate is never in percentage. Mind my words. Rate is never in percentage, people. Rate is never, ever in percentage. Rate, the multiplier in rate, start from 1000. It can be 1000, 10,000, lakh, 10 lakh, crore. It can be anything, but it's never 100. It's usually 1000, but it can be anything. But it's never 100. So what is the definition of rate? You tell me the 4 things about the rate. You tell me about numerator and denominator. Numerator is a part of denominator. Numerator and denominator. So numerator is a part of denominator. First of all, the people in the numerator are from denominator only. Number 1. Number 2, time specifier. Yes, time specifier is usually 1 calendar year. 2024, 23, 22, anything. And multiplier is usually 1000. It can be anything. 10,000, 10 lakh. But it's never 100. It's never 100. You have to learn that. So learn the properties of rate. I hope you got it. What is rate? Now you see the definition. You can recreate it in your own words. So that is rate. Okay, that is rate. Now coming on ratio. I guess everyone know what is ratio. Dividing one quantity by another. Okay, suppose how many boys and how many girls are attending this class right now. Okay, suppose there are 10 boys and there are 3 girls. For example, there are 10 boys in a class and there are 3 girls in class. So what's the ratio of boys to girls? Boys to girls is 10 is to 3. And what's the ratio of girls to boys? It's 3 is to 10. You can see the ratios. Okay, so dividing one quantity by another. Here numerator is not a part of denominator. Just a second. You can see here numerator is not a part of denominator, neither denominator is a part of numerator. They are 2 separate quantities. What is boys upon girl? What is girl upon boys? Like that. Okay, numerator and denominator, they have nothing to do with each other. They are not part of each other. They are not part of each other. That is ratio. There is no multiplier. No 10, no 100, no 1000. There is no multiplier. Okay, so you can see numerator and denominator are two different entities. They are not part of each other in contrast to rate, where numerator was a part of denominator. Here, numerator is not a component of denominator. They are two separate entities. Number one, time specifier may be there, may not be there. In contrast to rate, where time specifier is always there, that is 1 calendar year. Here we don't have time specifier. It can be there, it cannot be there. It's not compulsory, I mean. And multiplier is absent. There is no multiplier, no 10, 100, 1000, 10,000, no multiplier. Got it? So that is the properties of ratio. Coming on the third thing, proportion. Can I start the proportion? Let's start the proportion. The third thing is the proportion. Rate is done, ratio is done, now proportion. In proportion, again, numerator is a part of denominator like rate. Like rate. Yes, you heard me correct. Numerator is a part of denominator. Now you may be thinking, ma'am, then what is the difference between rate and proportion? There also numerator was a part of denominator. But there we have a time specifier, na? 1 year. Here we don't have time specifier. No, it is instantaneous in time. If we don't have a time specifier of 1 year, 1 month, 1 day, we don't have time specifier. It is instantaneous in this instant. Instantaneous in time. No time specifier. We don't have time specifier. Number one. And number two, the multiplier in rate was 1000 or more than 1000. It was never 100. Here multiplier is always 100. So proportion is always in percentage. Proportion is always in percentage. I hope you got it. Now you read the definition, you will get it. Now for example, see the formula of case fatality rate. I will teach you all these topics in detail. What is case fatality rate? I'm going to teach you today only. Okay, but have a look on the formula. Grossly, you just see the formula. You decide this formula is rate or ratio or proportion. You decide by yourself. You decide. See the formula. Number of deaths upon number of cases. So the people who are case, suppose there are 100 cases of cancer. Okay, say brain cancer. 100 cases of brain cancer. Out of which 80 are dead. Out of which 80 are dead. So these people who are 80, they are from this 100 only, no? From these 100 patients only, these 80 are dead. The remaining 20 are surviving. Yes or no? So numerator is a part of denominator, first of all. Okay, there is no time specifier. You can't see 1 year, 1 month, 1 day. No time specifier. And you can see the multiplier is 100. Since the multiplier is 100, it's percentage and it's proportion. So I hope you got the difference between the three. So what are the properties of proportion, you tell me? What are the properties of proportion? Here, numerator is again a part of denominator. Like rate. Time specifier is absent in contrast to rate, where time specifier was 1 year. Okay. And here multiplier is always 100. It is expressed as percentage in contrast to rate. How many of you got it, people? Are you getting it? Yes or no? Kindly reply in the comment box. Are you getting it? Huh? Are you finding it interesting? So we have done the three tools of measurement. What is rate? What is ratio? What is proportion? So I have drawn a flowchart for you people. Can you see this flowchart? How to decide if I give you any particular formula. Now in PSM we are having many formulas. So from day one only, let me specify. You have to make a separate copy for the formula. Okay, the notes are provided by me. So whenever any formula come now, so you write that copy community medicine formulas. You enumerate all the formulas at one place. So there will be many formulas in biostatistics, screening of the disease, and many chapters we are having. So you just enumerate all the formulas at one place. It will be easy for you to solve the numericals by just revising that copy. Okay, now come. So whenever any formula is given to you, you have to identify whether it is a rate or ratio or proportion. Okay, but you don't have to mug up. The students who don't have this concept, they used to learn like infant mortality rate is a rate. They used to mug it up. Okay, like for example, maternal mortality rate is not a rate, it's ratio. It's ratio. Sex ratio is a ratio. Incidence is rate, but prevalence is proportion. So they used to learn that. I don't think so. You have to learn the formula, but you don't have to learn whether it's a rate or ratio or proportion. You have to decide on site. How you will decide it? So this is the flow chart. You have to follow step by step. How you will follow? First of all, look at the numerator and denominator. Okay. See the numerator of the formula, denominator. We will see the examples. Don't worry. So first see the numerator, see the denominator. Then you see numerator is a part of denominator. Say yes or say no. Say yes or say no. Numerator is a part of denominator, yes or no? These are two different entities. Numerator is separate, denominator is separate. They don't have any correlation with each other. They are just two separate entities. Is it the scenario? If it is the scenario, it's ratio. There is no confusion. If numerator and denominator are two separate entities, it's going to be ratio. Obviously, we have understood so. So here numerator and denominator, they are not part of each other. They are two separate entities and it's a ratio. But if numerator is a part of denominator, if numerator is a part of denominator, it can be rate, it can be proportion. Now to decide this, you have to see the remaining two things. You have to see for time specifier and multiplier. If the time specifier is present and multiplier is 1000 or more than 1000, it's rate. But if the time specifier is absent and multiplier is 100, that is percentage, it's proportion. So if you are following this flow chart, there is no confusion. I don't think there is any confusion. So can we revise it quickly, people? Can you help me? Rate, ratio, proportion. Summary of rate, ratio, proportion. Same. So numerator, denominator, numerator, denominator, numerator, denominator. They all have numerator and denominator. Here numerator is a part of denominator. Here also numerator is a part of denominator. But in ratio, numerator and denominator are two separate entities. They don't have any relation with each other. Okay, they are separate quantities. They are just dividing one by other. Okay. Now coming on time specifier. What about the time specifier? Here we have the time specifier and that is usually 1 year. Here we can have, we cannot have. Sometimes we have, sometimes we don't have. And here definitely we don't have. We never have time specifier. We never have time specifier. Not third and the last thing, we have to see the multiplier. Here the multiplier is usually 1000, but it can be 10,000, it can be more than that. Here multiplier is absent. We don't have any multiplier. And here multiplier is always 100. So if you are remembering it by this or by this flowchart, anyhow, you can crack the simple MCQs in your exam. Yes or no? So look at the formulas. You have to learn these formulas. I'm not saying you don't have to learn these formulas. I will help you to learn each and every formula in the next 4 months. The next 4 months, I will make these 4 subjects a cakewalk for you. You just believe me. Okay, listen. So all these formulas we will understand. We don't mug up just. Okay, we will understand. And by understanding these formula, we will try to figure it out whether each of them is the rate or ratio or proportion. I'm not reading each of them. Have a look. You can yourself decide. Is it a rate? Is it a ratio? Is it a proportion? Have a look on the formula. See the numerator, see the denominator. You get many MCQs on that. Believe me, you get many MCQs, especially the MCQ portion is from this. Okay, theory portion is not from this. Now I'm having some MCQs. I want all of you to write your answer in the comment box. Let me see who is first and who is correct. Okay, chalo. The first question is in front of you. Read the question, tell me the answer. Let me help you to read the question. All of the following are true regarding ratio. Except. The question includes the word except. Now read the 4 options. So which of the following is incorrect for ratio? Can you tell me which of the following? So numerator is the component of denominator. In the ratio, numerator is a component of denominator, yes or no? I don't think so. Numerator is not a component of denominator. Yes. Numerator and denominator are two separate entities. They are not component of each other. I think this one is correct. Yes or no? What do you think? Numerator and denominator are not related values. Okay. It is expressed as a number. Okay. So only this one is incorrect and the remaining 3 are correct. I forgot. It was the except question. So the correct answer is A and all of you are right. Let me see who is the first to answer. Nalan Deva. Yes, very good. Very correct. So Nalan, you are absolutely right. And the answer A is correct. Okay, so can we go on the next? Okay, you can see, you can decide your answer over here. The next, case fatality rate. Is it a rate, ratio, proportion? For this, you should know the formula of case fatality rate. You don't know the formula? I will tell you the formula. What is case fatality rate? What is case fatality rate? What is CFR? Case fatality rate. Here I told you the formula. Na? You can see the formula over here. It's the total number of cases and deaths. So numerator is a part of denominator. You can see the people who are dying are from cases only. But the multiplier is 100. Since the multiplier is 100, it includes rate. The word include rate, but it's not a rate. It's a misnomer. It's not a rate. Actually, it's a proportion. And it's a patent question of the examiner. Since case fatality rate include the word rate, it's a misnomer. Students get confused. They think it's a very easy question. Case fatality rate is a rate. No, it's not a rate. It's a proportion because the multiplier is 100. It's in percentage and there is no time specifier. Numerator is a part of denominator. So correct answer over here is C and most of you are right. Okay, most of you are right. I guess the first one is the Coven. Coven is first one to answer. And most of you are right. Yes, correct. Okay, now before I start the next topic, okay, you must understand what is midyear population, because I will use this terminology very frequently. What is midyear population? Before I teach you what is midyear population, let me ask you a leading question. Let me ask you a question. Okay, you can see this is India. Okay, now in India in 2024, that is already passed. In 2024, what is the population of India? What is the population of India in 2024? Does anyone know? Huh? You see, the population keep on changing every day, every minute, every second, I must say, and every moment. Okay, we are talking with each other right now. Okay, every moment, thousands of people are taking birth, and simultaneously, thousands of people are dying. Every fraction of second, every moment in India and everywhere. So this thing is, it's a very dynamic situation. It is not constant. I shall tell you one figure. Every moment it keep on changing. So in 2024, it's a big time. Okay, there are 12 months in a year. So which fraction population shall I tell you? 2024 में कौन से moment की population we will take it as a final population? You are getting my point? Because every moment in January it was different, in February it was different, in March, April, May, June it was different, because every second it keep on changing. People are taking birth, people are dying. So it is plus minus, every moment it is changing. Okay, so let me try to explain you. We will find out a solution for this. So as I told you, there are 12 months and I'm teaching you mid-year population. Mid-year population. So let's take 6 months this side. Let's take 6 months this side. Total 12 months. Approximately July. 1st July is the midpoint. 1st July is the midpoint. 6 months this side. 6 months this side. So 1st July population is mid-year population. The mid-year population is the 1st July population. Since it is the center of the year, approximate, not exactly. If you say that February have less days and all, but approximately it is at the center of the year. So we will take mid-year population as the population on the 1st July. Population on the 1st July every year in 2024, in 2023, in 2022. Okay, the population on the 1st July is mid-year population. So you get an MCQ on that. 1st July of any year. That is known as mid-year population of that particular year. Okay, now I will use this terminology very frequently. Now, before I come on the studies, before I come on various types of epidemiological studies, case control, cohort, you must understand mortality and morbidity. You must understand what is mortality. You must understand what is morbidity. Not only this, you must understand the measurements of mortality and measurements of morbidity. How to measure mortality in any geographical population, in a country, in a city. How to measure morbidity in any geographical population. So before coming on the measures directly, you must have a understanding of the meaning of these words. Bhai, hota kya hai? What is mortality? What is morbidity? What do you mean by that? What is mortality, morbidity? What do you mean? Meaning kya hai? What is meaning? So let me start them one by one. Mortality. Mortality means death. Okay, the end point, the death. Okay, the end point of life. So death, if we take death as an event in a given frame of time, okay, that is known as mortality. For example, in community medicine, I will teach you infant mortality rate. Okay, it is a death in the infants. Okay, maternal mortality ratio, it is the death in the maternal period. Okay, so that is the mortality. Mortality means death. Mortality means death. What is morbidity? Okay, the two terms look similar, but you have to understand the difference. This is mortality, you can see mortality, and this one is morbidity. Please understand. Okay, what is morbidity? Morbidity means sick, illness, sickness, you can say. Okay, any departure from the health, any departure from physiological well-being, maybe subjective, maybe objective. Maybe the person is subjectively not well, maybe the person objectively not well. But if the person is not well, we will say morbid. It can be any disease. It can be fever, it can be typhoid, it can be malaria, it can be COVID, it can be diabetes, it can be any, it can be cancer, it can be any disease. The person is not well. That is morbidity. Morbidity means sickness or disease state or illness, whatever you say. Okay, so that is morbidity. So you understand the difference between mortality and morbidity? I guess everyone have understood. What is mortality? It is death, you can see. And what is morbidity? Morbidity means sickness, illness. Okay, deviation from the physiological well-being. You can see the definition. Any departure from physiological well-being. Maybe subjective, maybe objective. But departure from the physiological well-being is morbidity. You have to learn these definitions. What is mortality? Death is the event. Okay, what is morbidity? Departure from the physiological well-being. Maybe physiological, maybe physical, maybe psychological, maybe objective. Okay, now you have to do the measurement. How to measure the mortality and how to measure the morbidity. Can you tell me the ways to measure? How to measure mortality and how to measure morbidity? For example, India 2024. Can you tell me the mortality of India in 2024? How to measure it? How shall I measure? Tell me the steps. What shall I do? I want to know the mortality of India, of a particular geographical population in 2024. We can take any country. For the sake of understanding, I am taking India every time. And we can take any timeline. For the sake of understanding, I am taking 2024 every time. But you can take any geographical population, any country, any part, and you can take any time frame. Okay. How to calculate mortality and how to calculate the morbidity? If I want to calculate the morbidity, how to calculate that? In India in 2022, what are the ways? What are the ways? For mortality measurement, we are having 6 ways. I will teach you all 6 one by one, the formula of all 6. And then we will see the numericals also. Okay, these are the 6 ways of measuring mortality. That's difficult and you get many MCQs on that. And it is important for theory papers also. Okay, and what are the ways of measuring morbidity? Morbidity means I have to say some disease. If I want to measure morbidity, I have to enumerate some disease. Which morbidity? So I want to know the morbidity of TB. Okay, or else I want to know the morbidity of diabetes. I want to know the morbidity of road traffic accident. I have to say any event, any disease. Okay, so you have to calculate the morbidity of that particular disease, particular event. Yes, so for calculating morbidity, we are having 2 different measurements, that is incidence and prevalence. So first we will see the measurement of mortality. I will teach you all these 6 one by one, and then we will come on the measurement of morbidity. I will teach you both of them one by one. How many of you are ready? How many of you are understanding the session? Say something, people. Yes, no. Let me see the comments just a second. Yes, I can see. Okay. Okay. Can we go ahead? So these are the 6 ways of measuring mortality. These are the 2 ways of measuring morbidity. So first we will start with the ways of measuring mortality. So these are the 6 ways of measuring mortality. Mortality means death. How to measure death in a geographical area, in a geographical population? How to measure that? There are 6 ways. What are these 6 ways? The first is crude death rate, known as CDR, crude death rate. The second is specific death rate, known as SDR, specific death rate. Crude death rate, specific death rate. We will see the differences between them. The third is proportional mortality rate, PMR, proportional mortality rate. You have to learn these short forms, CDR, SDR, PMR. You get MCQs like that only. You get an MCQ on PMR. You should know its full form. What is CDR? What is SDR? What is PMR? You should know what is survival rate, SR. You can see this is SR. You know what is case fatality rate? That is CFR. And what is standardized mortality rate? That is SMR. So these are the 6 ways. Okay, so we will make a table. Okay, in this table you can see all the 6 ways are written over here. These are the measures of mortality, that is death. Okay, the 6 measures of mortality. We will see the difference. It's a very interesting topic. You can see this is crude death rate, this is specific death rate, this is proportional mortality rate, this is survival rate, this is case fatality rate, and this is standardized mortality rate. So first of all, you learn their full form, you learn their short forms. Now make this table. Take out your notebooks. What you are waiting for? If you have not yet taken your notebooks, please take out your notebooks, take out your pen and start making this table with me. It will be very useful table for your exams. Okay, you have to write down the formula over here. Write down the 6th formula one by one. In each formula, you have to notice what is numerator, what is denominator, what is multiplier, and what is time specifier. And you have to decide whether it's a rate or ratio or proportion based on the formula. Looking at numerator is a part of denominator, yes or no? Multiplier is 100 or 1000 or multiplier is absent or time specifier. If you are attending my session from the beginning, you are understanding what I am saying now. So I will tell you the 6 formulas. I will help you in understanding the 6 formulas. After that, you have to decide whether it's a rate or ratio or proportion. We will decide it together. After that, you have to write down the properties. You have to write down the properties of each of them on which you get maximum MCQs. So can we start one by one? People, be interactive. Can we start? Okay, chal. So let's start it. Let's start them one by one. So this table is already filled for you. One by one we will take it. This is empty table that we will fill again in the end. I will fill it for you again. But this is the pre-filled version. You can see. So write down the formulas over here. In the formulas you have to mind the numerator and denominator. See the numerator, see the denominator. And you have to see whether numerator is a part of denominator, yes or no. Numerator is a part of denominator, yes or no. Number one. Number two, what is the multiplier in each of them? Is it 100, 1000 or absent? And then you have to decide the time specifier, present or absent. And based on that, you decide whether it's a rate or ratio or proportion. That's why I taught you the tools first. Then I'm coming on the measurements now. And then you have to learn the properties. The properties is something based on the formula, you can understand them. Let's start one by one. Let's start the first one. Can you see? I'm starting with the first one. I'm starting with the crude death rate. Let's start CDR. Let's start the crude death rate. CDR. Say the full form. What is CDR? Crude death rate. So what is crude death rate? Crude death rate. Look at the formula. Don't look at the definition. Look at the formula and try to create the definition in your own words. Okay, it will be easier. If you learn the definition and create the formula, you will get confused. So according to me, you should learn the formula. So what is crude death rate? Crude death rate, see the denominator first. Always see the denominator first. In the denominator, you have midyear population. Appreciate the midyear population over here. Midyear population, now you understand what is midyear population of India in 2024? The population on 1st July, midnight, raat ko 12 baje. So midnight population of 1st July, snapshot, it is taken and it is considered as midyear population of that particular year, 1st July. Okay, so midyear population, suppose 2024 of India, and how many people were dying in 2024 in India? So suppose we are talking about India. You know the map of India? I'm drawing just a rough map. Okay, India. Okay, India 2024. India in 2024, what is the midyear population and how many people were died in 2024? Total people dead from 1st January till 31st December. How many people were dead? You write that as a numerator. And what is the midyear population on 1st July? You write as a denominator. Okay, and since it is having a time multiplier and the multiplier here is 1000. It's not 100. My words is 1000. So this is the formula. This is the formula. Now you decide, is it a rate or ratio or proportion? You see, the people who are dying are from population only. They are not aliens. They are from this population only who are dying. The people who are dying are from this population. So numerator is a part of denominator. There is a time specified, that is 1 calendar year. And there is a multiplier which is 1000, not 100. So it's a rate. No need to learn, it's a rate. So crude death rate is actual rate. It's a rate. So you know, denominator is midyear population. You get MCQ on that. Okay, among the 6, it is the simplest measure of mortality. Among the 6, there are 6 types of mortality. Now I will teach you all. This one is the simplest. This one is the simplest. You get MCQ on that. It is not best. It is not best. The best one will be the last. The best one will be the last. That is the sum. Please mind my words. You get 2 questions. The simplest measure of mortality, answer is CDR. The best measurement of mortality, answer is SMR. Understand? Why? I will tell you reason also. Okay, got it? So this one is the simplest one, but not the best one. You can write down in the bracket, not best. It is simplest, but not best. You are getting it? What is crude? Crude ka matlab kya hota hai? What do you mean by crude? The word crude. Crude means all. Non-specific. Non-specific means all. So here in the numerator, we are including all death. See the word all. Highlight the word all. Mark the word all. You're getting it? All death. Whether the death is due to diabetes, death is due to cancer, death is due to heart attack, cardiovascular disease, death is due to cancer, suicide, road traffic accident, any death in India. Okay, death due to suicide, homicide, any death in India, all death in India we are including. That's why the word is crude. Okay, it is not specific because it does not specify any particular death. We are including all. That's why crude. And that's why it is the simplest, but not the best. Not the best. Okay, it reflects the health status of an area. If crude death rate of some area is more, more people are dying in that area. If crude death rate of some area is less, so it means that area less people are dying. Okay, so it indirectly reflects the health status of a geographical area of a country. Suppose we are comparing the crude death rate of India and US. We are having 2 countries. So what is the crude death rate of India? What's the crude death rate of US? And we can compare the health status of the 2 countries by comparing the crude death rate. It is the simplest measure of mortality. Yes or no? So these are the properties. We are done with the first one. Okay, crude death rate is done. We have to go with 6. Out of 6, 1 is done. Okay, remaining 5. Yes or no? You can see. Crude death rate. Learn the formula. See the denominator first. Make a habit. First we have to see denominator. The denominator is mid-year population. You know what is mid-year population. The numerator is all death. All. Include the word all death. And multiplier is 1000. Since the multiplier is 1000 and numerator is a part of denominator, it's a rate. It is the simplest measure, and B include crude. That is all that. Coming on the second one, you understand the second one by yourself now. It is specific death rate. This was crude. Crude. Say the word crude. Bolo. Say crude. Say the word specific. Specific is opposite of crude. Crude is non-specific. Okay, and I am teaching you specific death rate now. SDR. What is SDR? It's specific. It's not crude. It's specific death rate, the opposite of crude. Okay, it includes specific death. Okay, the denominator is same. The denominator is still mid-year population. The denominator is still mid-year population, like the crude death rate. But the numerator don't include all death. It includes death from a specific cause. Maybe the death due to diabetes only diabetes death. Okay, maybe the death due to TB, maybe the death due to cancer, maybe the death due to suicide, maybe the death due to road traffic accident, maybe death due to any particular cause, any particular group, any particular timeline. That is specific death rate. And multiplier here also we have 1000. So the people who are dying are from population only. The people who are dying are from this population. They are not aliens. I am saying again and again. So again, numerator is a part of denominator. Multiplier is 1000. It is also rate. It is also rate. But it is specific. Okay, the specification can be of three types. It can be cause specific, group specific, period specific. I will give you three examples. What do you mean by cause specific? What do you mean by group specific? What do you mean by period specific? What is cause specific? Okay, so denominator is mid-year population. Numerator is people dying due to diabetes. Cause specific, people dying due to TB, people dying due to cancer. Some specific cause. Okay, that is cause specific. Group specific, what do you mean by group specific? You can see total number of live birth, denominator, total number of live birth. From the total number of live birth, how many 1 year, less than 1 year, I mean infants. So we are taking a particular group. We are not taking particular disease. Here we have taken particular disease, specific disease. Here we have taken specific group. I mean infants, under 5. We can take any group, maternal mortality during pregnancy, like that. We are taking any particular group, or it can be period specific. So we are taking mid-year population of India in 2024. Always consider India in 2024. Okay, mid-year population, for example, India in 2024 का mid-year population, and numerator is number of deaths in the March in India in 2020. Okay, so we are taking period specific. Period. So it can be period specific, it can be group specific, it can be cause specific. So specification can be of three types. What are the three types of specification, people? It can be cause specific, I mean particular disease. It can be group specific, I mean any particular group, I mean infants, under 5, maternal, like that. Or it can be period specific, particular month, particular day, like that. So there is specific. It is not crude. We are not including all, I mean all disease, all groups, all months. No, we can take particular disease. We can take particular group. We can take particular period. So it is opposite of crude. You got my point, huh? What are the properties? Here also denominator is mid-year population. There also denominator was mid-year population. Here also it's mid-year population. It is also rate because multiplier in both of them is 1000. Okay, but it is good for comparison. It is good for comparison. What do you mean by that? For example, I'm comparing SDR of two diseases. Suppose SDR of diabetes and cardiovascular disease. Okay, cardiovascular disease in India in 2024. So what is the numerator? What is the denominator? What is the numerator? What is the denominator? Huh? Denominator in both of them is mid-year population. Okay, mid-year population. Here death due to diabetes, and here death due to cardiovascular disease. Multiplier is also same. Multiplier is also 1000. So I can compare now. People are dying in India. People are dying more of diabetes or more of cardiovascular disease. So it is good for comparison. It is good. Crude death rate is not good for comparison, but this one is good for comparison. I can compare all the deaths. Okay, and I can see what is the biggest cause of death in India. And we can compare. It is good for comparison. So learn this point. It is good for comparison between different causes with the same population. For example, our fixed population is India. So that is specific death rate. So we are done with two till now. Compare them. See, we are done with crude death rate. We are done with specific death rate. See the denominator of both of them. See, here also we have mid-year population. Here also we have mid-year population. See the numerator. Here we include all death. Here we include specific death. Specific death. Here we include all death. Here also 1 year. Here also 1 year. Multiplier is 1000. Both of them are rate. Okay, but this one is simplest and crude. This one is good for comparison. Got it till now? Everything is fitting, imbibing in your mind forever? Yes or no? Coming on the third. The third is PMR. What is the full form of PMR? What is the full form of PMR? It's proportional mortality rate. Is my speed is good? Am I too fast? I don't think so. I guess you are getting it. Yes or no? You are getting it? Write down in the comment box, please. Are you getting it? We will solve some numericals also based on that. Okay? Just a second. Okay. Yes. Yes. Perfect. Thank you. Thank you. Thank you for responding. So coming on the third one. The third one is proportional mortality rate, PMR. It is death upon death. What is proportional mortality rate? I call it death upon death. What do you mean by death upon death? What is PMR? Proportional mortality rate. The numerator and denominator, both of them are death. I mean death upon death. The denominator is not mid-year population. Mind my words, like CDR, like SDR. No, it is death. It is total death. Total death in India. How many people died in India in 2024? How many people died in India 2024? Total death. So total death is the denominator. Out of which specific death. Death due to some specific disease. Okay. Maybe diabetes, maybe TB, maybe any disease. That is the numerator. And multiplier is 100. 100. That is percentage. Okay. So it will be a proportion. It will be a proportion. Okay. So out of the total death in India, out of the total death in India in 2024, how many people were dead because of TB? So the people who are dying of TB are from the total deaths only. So numerator is a part of denominator and the multiplier is 100. Okay. So it is a proportion. It is a proportion. I hope you got it. So it is death upon death. You are getting my point. See, I call it death upon death. Death from a specific disease upon total death. Death upon death. Into 100. Mind it. Mark it. It's 100. It's not 1000. You can take any disease. Out of the total death, how many people died of TB? How many died of diabetes? How many died of cancer? Like that. So out of the total death, how many people are dying of a particular disease? Into 100. And that is expressed as percentage. And that is PMR. So PMR, denominator is not MYP. Denominator is not mid-year population. No. No, learn it. Like CDR, like SDR. It's not mid-year population. Okay. And the multiplier is 100. It is expressed as a percentage and that's why it's proportion. It's not rate like CDR, like SDR. Okay. And the specific thing is that it is the measurement of burden of disease in a community. We can see the burden of the disease now. Calculate PMR for TB. Out of the total death, how many people are dying of TB? Out of the total death, how many are dying of diabetes? Out of the total death, how many are dying with cancer? So what is the burden of TB in our community in India? What is the burden of cancer in India? What is the burden of diabetes in India? Like that. So it is helpful in calculating the burden of disease in a community. Burden of disease. Learn this word. Burden of disease. Okay. So that is the specific points regarding PMR. Appreciate the denominator here. Appreciate the denominator here. Appreciate the denominator here. Here it's mid-year population. Here it's mid-year population. Here it's total death. Okay. Appreciate the multiplier. Appreciate the multiplier. 1000. Here it's 100. Appreciate it is rate. It is rate. It is proportion. Okay. This one is simplest measure. This one is good for comparison. This one reflects burden of disease. Please fit in your mind. You get many MCQs over here. You can't afford missing this topic. If you are not learning this topic, you are doing a big mistake. Okay. Coming on the fourth indicator. Can I come on the fourth indicator? Let's come on the fourth indicator. The fourth indicator and fifth I will take together. Fourth and fifth I will take together. What is the fourth and fifth indicator? This is survival rate. This is case fatality rate. I will take them together because they are complementary to each other. You will understand them together only. First, you see the full form. What is the full form of SR? Say survival rate. What is the full form of case fatality rate? SCFR. It is case fatality rate. First, you learn their full form. Now, see. Listen. Everyone on the screen. Everyone here. Listen. See on your gadgets. Listen. So, this is a population. This is a group of people. They all have brain cancer. Unfortunately, they all have brain cancer. Suppose, okay, suppose they all have brain cancer today in 2025. Suppose, okay, for example, they all took treatment, chemotherapy, radiotherapy, okay, they all took the treatment, surgery, whatever treatment was applicable, they have taken that. So this is a group of people, they all have brain cancer detected this year only, 2025, they all are on treatment, they took the best possible treatment, chemo, radio, surgery, whatever possible for them, okay. Now after 5 years from today, that is in 2030, okay, this is 2025. 2025, they all detected brain cancer. They were treated. 2030, after 5 years from today. After 5 years from today. Okay. Some of them are lucky and they survived. They are still surviving after 5 years in 2030. But some of them were unlucky. After 5 years, they didn't survive. Within this 5 years, maybe in 2026, 27, 28, 29, they are dead. Okay. So some of them are dead. Okay. They didn't survive for 5 years. You are getting my point, what I am saying. So this is known as survival rate. Okay, and this is known as case fatality rate. Okay, suppose these are 100 patients. Okay, count them. Suppose these are 100. They all took the same treatment in 2025 today. And after 5 years, 20 of them survived. And 80 of them are died within the span of 5 years anytime. Maybe in 26, 27, 28, 29. Maybe anytime. They are dead. So I will say survival rate is 20% and case fatality rate is 80%. So they are complementary to each other. If 20% are surviving, so obviously 80% are dying. 100 minus 80, 100 minus 20 is 80. So they are complementary to each other. I hope you are getting, I'm trying my best, people. Please respond. I have put so many images, animations and flowcharts in a dry subject like community medicine. Have you seen the books of community medicine? They don't have images. Most of the books don't have images. But see my notes. See, my book is under publishing. See, it will be released soon. Okay. And they have abundant of images. Okay, same with the forensic medicine. They have abundant of images so that you have a better understanding in your mind. With the help of images, it imbibe in your mind. Yes or no? So what is survival rate here? 20%. And what is case fatality rate over here? It's 80%, you can see. So what is the definition? Now you see the definition. In both of them, what I have done. In both of them, what is the denominator? What is the numerator? You tell me. So survival rate, what is the denominator? What is the numerator? Case fatality rate, what is the denominator? What is the numerator? What is the multiplier? You have to tell me 3 things. Denominator, numerator, multiplier. The thing is over. That's it. Okay. Now denominator in both of them is cases. Case of brain cancer. For example, in our example, it was brain cancer. It can be any cancer. It can be any disease. So cases is the denominator. Out of the total cases of brain cancer, in both of them, the denominator is cases. Patients or cases, whatever you say. The denominator is not midyear population like CDR, SDR. The denominator is not death like TMR. The denominator is cases, patients, cases who are diagnosed as disease, any disease. In our example, we took brain cancer. Out of the total cases, how many survived after a particular span? In our example, we took 5 years. We can take 10 years, we can take 20 years. It's our choice. Okay, so how many survived after 5 years? Okay, and here how many of them are died after 5 years? This is the definition. This is the formula of both of them. Multiplier in both of them is 100. Okay, now the people who are surviving are from cases only, and the people who are dying are from cases only. So in both of them, numerator is a part of denominator and multiplier is 100. So both of them become proportion. It is not rate, it is not ratio, it's proportion. Both of them are proportion. I hope you are getting it. People respond. Say, yes. So you understood what is survival rate and what is case fatality rate. Say. So this is survival rate, this is case fatality rate. See the formula of both of them. Now can I start? I shall start the next two. Survival rate followed by case fatality rate. See the formula. Okay. Now survival rate. You tell me the formula. What is the denominator? Denominator is midyear population? No. Total death? No. Denominator is cases. Cases or patients. Total cases or total patient. Out of the total cases, how many survive? How many survive after 5 years? Into 100. Multiplier is 100. That is survival rate. You create definition by your own. Don't try to mug the definition. People in my class. If you try to mug up now, you will forget the thing. You will forget the concept. Learn the formula. From the formula, you can recreate the definition in the exam. In your own words. Learn the formula. Don't do the mistake in the formula. Especially in the denominator. If the denominator is right, definitely numerator will be right. And multiplier, you have to focus on the multiplier of each of them, whether it's 1,000, it's 100, like that. Okay, this is survival rate. Okay, so you know the formula. You tell me the properties. What is the denominator? Learn the denominator. I have enumerated the denominator in all of them. So you have to focus on denominator. So here denominator is total cases or total patients. Since the multiplier is 100, it's proportion. It's in percentage. It tells us the prognosis of the disease. Now, here I told you the example. You say only 20% out of 100, only 20% are surviving. 80% are dying. That's a very bad thing. So can I say that brain cancer have a very poor prognosis? After 5 years, only 20% people survive and 80% usually die. So prognosis is poor. So looking at the survival rate, we can comment on the prognosis of the disease. Can we comment? Yes. So it indicates the prognosis of the disease. Understand it. You will never forget, people. If you try to mug up now, which is the indicator among the six of them, which is the indicator for prognosis of disease, you will forget. But once you understand, you will never forget. Okay, it indicates the prognosis of the disease. Not only this, it's the yardstick for the assessment of standard of therapy. Listen again, one more example. These are 100 cases of brain cancer in 2025. They all have brain cancer. These are 100 cases of prostate cancer. They all have prostate cancer in 2025 right now. They are diagnosed with brain cancer, unfortunately. They are diagnosed with prostate cancer, unfortunately, 2025. Okay, they took the treatment of breast cancer, brain cancer, the best available treatment today's date. Okay, and they took the treatment for the prostate cancer after 5 years. Here, after 5 years, here, I mean in 2030. Let's see. So here, only 20% of them survived and 80% died. Here, reverse occurred. 80% survived and only 20% died. You will say, why it's like that? Here 20% surviving and here 80% surviving. Why like that? After 5 years, both are cancer. So I must say treatment. Here the treatment which is available is not so good. Yet we have to discover better ways of treating them. It's under discovery. It's under intervention. Invention. Yes or no? But here we have good treatment available. That's working and that's why people are surviving. Yes. So can I say, looking at the survival rate, we can comment on the standard of therapy available for that disease. And survival rate are basically for cancer studies. We usually compare cancers for them. So these are the important properties you have to learn. Survival rate. Survival rate indicates prognosis of the disease, indicates the standard of therapy of the disease. Indicates two things. What two things? What two things it's indicating? Prognosis of the disease, and it is indicating the standard of therapy. Yes or no? And it is good for cancer studies. These are the properties. This you already know. So this is survival rate. After survival rate, coming on case fatality rate, you already know that. We have done the survival rate. Now we will come on case fatality rate. So let's come on case fatality rate. What is the formula? You tell me the formula. What is case fatality rate? This one is the case. The people who are dying after 5 years. The people who are not surviving. The people who are surviving is survival rate after 5 years of treatment. The people who are not surviving, they are dying. Okay, that is case fatality rate. So what is case fatality rate? Can I say? It is the complement of the survival rate. 100 minus survival rate is case fatality rate. If survival rate is 20, so case fatality rate is 100 minus 20. That is 80. That is 80. So can I say it is complementary? Complementary to the survival rate? Yes. It is a complementary of the survival rate. It is 100 minus survival rate. 1 means 100. Consider 1 is 100. 100 minus survival rate is case fatality rate in terms of percentage. Okay, so this is case fatality. What is the formula? Formula, denominator is same. Cases, total cases. Out of the total cases, after 5 years, how many are dead? After 5 years, how many are dead? They are not surviving. After 5 years, they are dead. And multiplier here is also 100. So it is also a proportion. Okay, so denominator is same. Cases or patient. It is also a proportion. So it indicates the killing power of a disease. You are understanding? It is indicating the killing power of a disease. If I say the case fatality rate is 80% of the brain cancer, you will say my brain cancer is having a high killing power. It is killing 80% of the people in 5 years. Only 20% are surviving. So it is indicating the killing power of a disease. Or if it is a communicable disease, it is indicating the virulence of the organism. You know, bacteria, viruses, they have virulence. Virulence is tendency to infect the human. So it is virulence. It is indicating the killing power of the disease, or it is indicating the virulence of some organism. So survival rate indicates two things. Case fatality rate indicates two things. What are the two things they are indicating? You tell me. You have to learn the properties, people. I'm trying hard so that it fits in your mind during the session only. So survival rate indicates two things. It is indicating prognosis of the disease, and it is indicating the standard of therapy. standard of therapy, which cancer we are having good therapy, for which we are not having good therapy, like that. Okay, and here case fatality rate indicates two things. It indicates the killing power of a disease, and it is indicating the virulence of organism. You have to learn them. You have to learn them for your MCQs. Okay, so that is, we are done with the 5. Till now we are done with the 5. What 5 we are done? Now we will come on the last indicator of mortality. That is standardized mortality rate, the best indicator among the 6. Yes, you tell me what 5 we have done till now. You can see crude death rate, the denominator is midyear population. Standard death rate, the denominator is again midyear population. Here numerator is all death. Here numerator is all death. Here numerator is specific death. Specific death. Multiplier in both of them is 1000. That's why both of them are rate. Both of them are rate. Okay. Now proportional mortality rate is death upon death. Okay, death. But multiplier is 100. Multiplier is 100. That's why it's a proportion. Okay. Now the next two, that is survival rate and case fatality rate. The denominator of both of them is cases or patients, one and the same thing, cases or patients. Here numerator, how many of them are surviving after 5 years, and here numerator is how many of them are dead after 5 years. Multiplier in both of them is 100. That's why both of them are proportion. And learn their properties. Who indicates the burden of disease? Who indicates the prognosis of disease? Who indicates the standard of therapy? Who indicates the killing power of disease? Who indicates the virulence of the disease? Who is good for comparison? Who is the simplest indicator? You get questions on that. I tried hard to explain each of them with their formula, with their tool, and with their properties. Can I come on the last one? People, anyone who is interested, raise your hand. Say. Got it? Am I not audible? Abhishek is saying I am not audible. The one who are live, can you tell me, am I audible or not audible? Am I audible? Someone in the audience is saying I'm not audible right now. Kindly write down so I that continue the session. Am I audible? Sumanna, Bogla, Pragana, am I audible? Okay, thank you for responding. The people who have responded, thank you so much. So I guess the problem is with some student, they should check their internet connection. Yes, okay, thank you so much, thank you. Thank you so much. Thank you for confirming. Okay. So let me come on the last indicator of mortality. Okay, which is the best one among the 6? I have not yet told you which one is the best. I told you which one is the simplest. The simplest is the first one, crude death rate. But which one is the best? None of them is best. The best one is yet to come. That is standardized mortality rate, SMR. Standardized mortality rate is the best indicator of mortality. Why? Why it is the best indicator of mortality and why we need so? What is the need? Before introduction of anything, you must understand its requirement. You must understand its need. Okay, let me come on SMR. What is the full form of SMR? Standardized mortality rate. SMR. Standardized mortality rate. Let me explain you what do you mean by. Let's take India. Okay, suppose currently I stay in Indore. Okay, it is in Madhya Pradesh. I'm staying here in Indore, Madhya Pradesh. I want to switch to some other city. Okay, due to any reason, I want to switch. Okay, now I'm having two options of switching. I can switch in Mumbai, I can switch in Delhi. For example, Mumbai and Delhi. Okay, I'm having two options. I can switch Mumbai, I can switch Delhi. So what should be my criteria? Okay, there can be lots of criteria based on which I can take my decision. For example, I want to compare the health status of the two cities. I want to change my city and I want to check the health status of Delhi and Mumbai. Okay, and the one which is having a better health status, I will shift in that city, for example. Okay, so for comparing the health status, I thought to compare the crude death rate. Okay, let's see what is the crude death rate of Delhi and what is the crude death rate of Mumbai. How many people are dying over here? And how many people are dying over here? Death is not a good thing. No? The people who are dying, the city where people are dying more, it indirectly indicates the health status of that city is not good. Maybe the hospitals are not good, doctors are not good, or the availability to the hospital or doctors is not good to the people. That's why people are dying more. That might be the common mentality, a common thought we all can have. So till now we are on the right track. I'm thinking the crude death rate. I will compare the crude death rate of the two cities and the one which is having high crude death rate. I will say, no, this is not a good city to shift because people are dying more. The people are not having good health status over there. Maybe not good hospitals, not good doctors, or not good facilities. That's why they are dying more. And the city which is having less crude death rate, that may have a good city because the people are dying less there. They may have better health condition, better doctors, better hospitals, better facilities. So based on that, I can take the decision. So what I have done, I have taken the two cities, Delhi and Mumbai. Delhi and Mumbai, and I suppose this is Mumbai map. I have not taken the exact map. Suppose this is Delhi map, and I have compared the crude death rate, the simplest measure of mortality. I taught you the simplest measure of mortality. I have compared the crude death. These are arbitrary figures. People, please don't check them on the internet or ChatGPT or anywhere. These are just arbitrary figures to explain you. So don't put in the comment box that CDR of Delhi is this or it's Mumbai. I know these are not real figures. I'm just explaining you whatever figure came in my mind. I have just quoted that. Okay, so CDR, suppose the CDR of Mumbai is 8.8 and CDR of Delhi is 11.5. What does it mean? So out of 1,000 people, 8.8 people die every year over here, and out of 1,000 people, 11.5 people die over here. Okay, so which city out of the two is having better health condition? Here people are dying less. Here people are dying more. Here out of 1,000, 8.8 people are dying. Here out of 1,000, 11.5 people are dying. So here more people are dying, no? So maybe this city, okay, don't have good health condition. Maybe this city have good health condition. Why people are dying more here? Maybe not good doctors, good facilities, good hospitals. Why people are dying less? They may have good facilities, health conditions over there. So that is a thought which is coming in my mind, and based on which I took the decision that I will shift in a city. I will shift in a city which is having less CDR. Which is having less CDR, considering that this will have better health condition and me and my family will get the good health condition, and there are less chances we will die in the next 100 years. Yes or no? So based on that, I'm taking the decision. But is my decision right? Is it a good criteria to compare the mortality of the two population? Don't go on the figures, people. These are arbitrary, just for explanation. Say population X, say population Y, instead of saying the name of some cities. Okay, so population X and population Y. Yes or no? You are getting it? Huh? So based on which I took the decision, I will shift in population X. I will not shift in population Y. Okay, but no, my comparison is absolutely wrong, because I have not compared the composition of the population. I have seen total population, but I have not seen the integral composition of the population. Every population have old people, young people. Yes or no? Here also old people may be there, young may be there, obviously. Here also old people may be there, young may be there. Okay, now everyone dies. That is the eternal fact of life. No, it is not a spiritual lecture, okay, but everyone dies. We all have to die one or other day. Okay, no one is immortal over here. So, but old people dies, there are more chances the old people will ultimately die. Okay, young people chances are less. So the city, the population which is having more old people, the crude death rate will be more, obviously. Okay, and the population, the city which is having more of young people, they will have less chances of death, no? So there will be less crude death rate. You're getting my point. For example, here I got less crude death rate. Okay, here I got less crude death rate, and here I got more crude death rate. Okay, so but maybe why here it is more? I have put the wrong signs. Maybe here old people are more. Here maybe old people are more. That's why crude death rate is more. And here maybe young people are more, and that's why crude death rate is less. Maybe it is like that. Now I have put the conclusion here crude death rate is high because here health facilities are not good. But maybe it is not the reason. Maybe health facilities are more good over here than here. More good doctors, good hospitals, good facilities. But here old people are more. If old people are more, no one can save them at one point of time. Okay, got it. So that's why crude death rate is. So it is not a good criteria to compare the mortality of two population. If you want to compare the mortality of two population, you have to do standardization. It is not standard way of comparing. CDR is not a good way of comparing two population, the mortality of two population. So how to compare the mortality then? We have to consider the age groups. Okay, I mean we have to do the standardization of age. You are getting my point? So we have to take the third population in between, and that is known as standard population. I'm having population X, I'm having population Y. To compare them, I cannot compare them directly. No, there is no way I can compare them directly. If you want to compare two population X and Y, or A or B, or Delhi or Mumbai, whatever you say, any two population you want to compare. Compare matlab kya? Mortality comparison I am doing. Okay, I want to compare the mortality, the death rates of the two population. I have to take third population in consideration, and that third population is known as standard population. Okay, then only we can do the comparison. Now you come on the topic, you will have a better understanding now. You got the clue now why we are introducing standardized mortality rate. Okay, so standardized mortality rate. So same thing is written. If we want to compare the death rate of two population, if we want to compare the death rate of two population, population X and population Y, Delhi, Mumbai, any two population. Okay, but they have different age composition. One population have more of old people, one population have more of younger people. Okay, they have different age composition. Then CDR is not a good way. We can't compare their CDR. CDR is a wrong way. It can, misdirect us. Okay, it is a wrong way of comparison. We can't compare them based on CDR. That's why if you want to make them comparable, you have to introduce a third population, and third population is standardized population, and that is the best mortality indicator because it is best for comparison. So here we are doing, here age is the confounding factor. Na? What is confounding factor? I will teach you tomorrow. Okay, but age is the confounding factor here. One population is having more of old people, one population is having more of young people. So age is the confounding factor which is giving false results. Based on the false results, my decision is wrong. I'm shifting in Delhi, not in Mumbai, thinking that I'm shifting in Mumbai, not in Delhi, thinking that Delhi has poor hospitals, poor doctors. No, but that is not the fact. Actually, Delhi have more good doctors, good facilities, good hospitals as compared to Mumbai. But the thing is that their old people are more. So that's why death rate is more. So it is giving us false results. So we have to do standardization. We have to do age standardization. And that's what we are doing in SMR. SMR is standardized mortality rate. Now you must think, ma'am, why only age is standardized? You must standardize gender also, you must standardize race also, you must standardize everything. Now I mean, I'm having two population. Okay, so why you are standardizing only age? Okay, now here Hindus, Muslims, okay, Christians, here also Hindus, Muslims, Christians, that should also be equal. Na? That should also be comparable. Here also business class, service class, business class, service class, that should also be comparable. Married, unmarried, that should also be comparable. You should compare every criteria, but that's not practically possible. We cannot standardize every criteria. Ideally we should, but we cannot. So the biggest confounding factor is age. If we can standardize on all these criteria, that is the best one, but we can't. That's why we standardize only one criteria, that is age. That is the biggest confounding factor. Ideally we should standardize everything. We should standardize the religion, caste, business, service, okay, married, unmarried, all the factors that can be the composition of a population. Okay, but age is the biggest factor of the death. Okay, deaths in Hindus, Muslims, Christians don't differ much. Deaths in business class, service class don't differ much, but deaths in old and young differ much. That's why age is the biggest confounding factor that must be standardized by taking a third population, that is standard population. I hope you are getting it. It's a difficult topic. That's why with the help of images, diagrams, I'm trying my best to explain you. Yes or no? Till now everything is good? Everything is good? Okay, so coming on standard population. So what is standard population? The third population. You must ask me, what is this population? It is a population in which the death in each age group is known. The death in each age group is known. You can see each age group. So in this, it can be any population. It can be national Indian population. It can be European population. It can be saggy world population. It can be any population in which this composition is known. Any population can be standard population in which this is known. I mean, 0 to 1, how many people are there? 1 to 4, how many people are there? 0 to 1 year, how many people are there? 1 to 4 year, how many are there? 5 to 15, 15 to 20, 20 to 25. At a 5 year of gap, how many people are there? You should enumerate this number. So this is standard population. Now, how we do the standardization? There are two ways of standardization: direct standardization and indirect standardization. There are two ways of standardization: direct and indirect. How we do the standardization? What is the difference between direct and indirect? In direct standardization, we take age specific death rate of our study population. These are two study population, population X and population Y. We take the age specific death rate of these population and apply on the standard, and then we compare. Then we compare the CDR of the two. Okay, we apply the age specific death rate over here, apply it over this population. We take the age specific death rate from here and apply it in this population, and then we compare the CDR of the two. Okay, that is direct. In indirect, we take the age specific death rate of the standard population, not of study population, and apply it on the study. That is the indirect. Here we are taking ASDR, that is age specific death rate. In every age group, we take the death rate. I will give the example also. So we take the age specific death rate of the the two study population, and apply it on the standard population. That is direct way of standardization. In indirect way of standardization, we are doing the reverse. Here we are taking age specific death rate of the standard population and applying it on the study population. Okay, you don't have to go much detail, but you have to understand this difference. Here we are taking age specific death rate of the study and applying on the standard. In indirect, we are taking the age specific death rate of the standard and applying it on the study. So we are doing reverse. Okay, so that is direct versus indirect standardization. Okay, I will show you some numericals based on that. Here only you have to learn that. And here we calculate SMR, standardized mortality rate, standardized mortality ratio actually, SMR. Observed death upon expected death into 100. Observed death, okay, observed death in the study population, expected death in the standard population into 100. Like that we calculate into 100, and it's a ratio. It's a ratio. Okay, it's a ratio you have to learn. So we are done with the 6 formulas. People, we are done with the 6 ways of mortality with their formulas, with their tools. Is it a rate? Is it a ratio? Is it a? It is a proportion. You will decide based on the formula, based on the multiplier. Okay. And finally, you have to learn the properties. You have to learn the properties of all of them. Properties pay, you get many questions. Believe my words. Believe my words. Can we revise it together? If you people are interested, can we do so? But you have to participate. You can't be quiet. You have to say in the comment box. Okay. Can we revise the formulas first? Based on which we will say, is it a rate, ratio, proportion? In the finally, we will see their properties. Passive teaching is not my way. I can read it passively, but that's not interactive. Okay, we will fill it. We will fill it with full energy. Or better way, you can take out your notebooks, you can take out your pen and make this table with me. If I can make on such a big board, you can make it on your copy at least. Yes or no? So take such efforts, take out your notebooks, copy, and start writing. Make this table with me. Chalo. So can we, now first of all, you tell me numerator, denominator and multiplier in each of them. So write down the numerator and denominator. First denominator. So crude death rate. In crude death rate, it's mid-year population. It's mid-year population. Specific death rate. Here also mid-year population. Okay, then what's the difference between the two? What's the difference between the two? Here, the numerator is all death. All death. And here numerator is specific death. All death means crude. Or specific death means specific. Okay, as the name indicate. Okay, multiplier in both of them is 1000. Here also 1000. Here also 1000. Since the multiplier is 1000, both of them are rate. This is also rate. This is also rate. Okay, I'm right till now. Any confusion till now? I guess it's good. This one is the simplest measure. This one is the simplest measure of mortality among the 6, not best. And this one is good for comparison. Comparison of two population. Comparison of the two diseases in the same population. Yes or no? So we are done with 2. Coming on the third one. Proportional mortality rate, PMR. What's the full form? PMR. Proportional mortality rate. It's death upon death. Death upon death. The numerator is death. The denominator is death. The numerator, denominator is total death. Total death in India in 2024. In 2024, what is the total death in India? From all causes. From 1st January till 31st December. That is the denominator. Among them, specific death will be the numerator. How many deaths were due to TB? How many deaths due to diabetes? How many deaths due to suicide? How many deaths due to accident? How many deaths due to dash, anything? So specific death, the specific disease, specific group, specific period. It can be any specificity. Okay, so that is PMR. Okay, death upon death. But here the multiplier is 100. Multiplier is 100. Okay, since the multiplier is 100, it's a proportion. This was a rate, but this one is a proportion. Appreciate the multiplier. Multiplier is 100 over here. And this one indicates the burden of disease. It indicates the burden of disease in a community. Yes or no? Okay. Now next 2 we will take together. Can you help me with the next 2? They are easy. Survival rate and case fatality rate. Survival rate, case fatality rate. The denominator is total cases. The denominator is total cases. Out of the total cases, how many survive after 5 years? And out of the total cases, how many dead after 5 years? Okay, it is not only 5 years. We can take any time span, 1 year, 2 year, 5 year, 10 year, but particular period of time. Okay, so out of the total cases, how many are surviving? Suppose 100 patients with brain cancer. All of them are treated today with chemotherapy, radiotherapy. Now, after 5 years, how many are surviving? Is the survival rate of the brain cancer. How many of them are dying? Is the death case fatality rate of the brain cancer. The multiplier in both of them is 100. 100. That's why both of them are proportion. Both of them are proportion and they are complementary to each other. They are complementary to each other. What is the properties, people? They indicate two things. What two things they are indicating? Survival rate indicate what? Survival rate indicates prognosis of the disease and it indicates the standards of therapy of a disease. Okay, and case fatality rate also indicates 2 things. It indicates the killing power of a disease and the virulence of a disease. Okay, can I come on the last one? The last one, standardized mortality rate. So what we calculate here, the standardized mortality ratio actually. So here we have observed death, okay, in the study population and expected death in the standard population. We took the third population standard, okay, and that is a ratio. This is ratio. It's a ratio, and it is the best indicator among the six. The simplest one is crude. The best one is standardized mortality rate. And here we do standardization for age. Ideally, we should standardize all, but usually we do age standardization because age is the biggest confounding factor. Am I crystal clear in my words? Am I crystal clear in my words? Yes? Okay. Thank you. Thank you for your compliment. Thank you so much. Can we go ahead? So we are done with the measures of mortality. Yes or no? Huh? So it's time to solve some MCQs. Let's see how much you have understood. Let's analyze. Okay. You have to write down your answer in the comment box. Fast and correct. Okay. Let's see who is first and who is correct. So first question is in front of you. Read the question. Tell me the answer quickly. Let me read the question for you. Following can be used as a yardstick for assessment of standard of therapy. Standard of therapy. Which can be the yardstick for standard of therapy? Is it SDR? Is it CFR? Is it PMR? Or is it SR? The four options are in front of you. What is the correct answer? Yes, most of you are right. The correct answer is D, and the first answer is deeps is the first answer. Correct. So survival rate is the correct answer. D is the correct answer. I guess you know. So you can see this is the survival rate, and here I told you the two properties of the survival rate. It is the yardstick to measure the prognosis, and it's the yardstick to measure the standard of therapy. Yes or no? Be fast in your answer. Please, everyone participate. At max, you will be wrong. It's okay, but kindly participate. You will learn from your mistakes. Okay, the next question is in front of you. Read the question and tell me the answer. Estimating the burden of a particular disease is measured by burden of particular disease. Is it PMR? Is it specific mortality rate SMR? Is it true death rate CDR? Or is it incidence of a disease? What measures the burden of disease in a community? Yes, most of you are right. Yes, who's the first one to write? Vandana is first to write. Yes, good Vandana, good one. So correct answer here is proportional mortality rate, PMR. So I told you over here, PMR indicate burden of disease. It is death per death. It indicates the burden of disease in a community. So that is PMR. Coming on the next question, it's in front of you. Most useful parameter to predict the virulence of an organism or virulence of an illness. The four options are in front of you. Is it SMR, CFR, secondary attack rate, that is SCR, I will teach you, and what is incidence? So out of the four, what is the correct answer? What measures the virulence of the organism? Yes, you all are correct. The first is Monica. Yes, congratulations Monica, you are right, and the correct answer here is case fatality rate. So I told you here, case fatality rate is indicating the killing power of the disease as well as virulence of the organism. So correct answer over here is case fatality rate. Next question over here. What is the denominator of case fatality rate? What is the denominator of case fatality rate? Is it total death? Is it total number of hospital admission? Is it total number of cases due to any disease? Or is it total number of death due to a disease? Here, death due to a particular cause. What is the correct answer? Denominator of CFR. Yes, most of you are right. The first one is again Vandana. Yes, congratulations Vandana. The correct answer over here is C. It is the total number of cases. I told you now, in survival rate as well as case fatality rate, in both of them, it is total cases. Total patient money, total cases. After 5 years, how many are surviving is survival rate. After 5 years, how many are dying is case fatality rate. So correct answer here is total cases. Okay, one more question. Which is best in order to make comparison between health status of two population? There are two population, Delhi, Mumbai, population X, population Y. I want to compare their health status, so I can shift in one of the city. I will shift in that population, okay, which is having better health conditions. So me and my family should get a better health condition. So based on what we should decide. Shall I compare the SMR of the two population? Shall I compare the disease specific death rate? Shall I compare the PMR or shall I compare the age specific death rate? What shall I compare before taking my decision? What is the correct answer over here? Yes, most of you are right. The first one, I guess many people are right here. I guess Deep is again first, or Janvi. Deep and Janvi are first to answer. So correct answer is SMR. Most of you are right. Okay, so we can see SMR It is the best indicator where age standardization is done, and we can compare the two population. We can compare the health status of the two population over here. So we are done with the mortality indicators. How many of you got it? So mortality indicators are done. Now we are coming, since mortality, what is mortality? Death. Death yani mortality. We have seen the 6 indicators of mortality over here. You can see in all of them, the death certificate is provided. Whenever any person dies, death certificate is issued by the doctor. Yes or no? So being a doctor, being a medico, you should know about the death certificate, how to fill it, what lines does it contain, because sometimes you are on your duty and some death have occurred in your presence in the hospital, in the casualty, in the ICU, and you must have issued, you should issue the death certificate for that particular event. Yes or no? So you should know what you have to fill, how you have to fill. You should have an idea about that. Yes or no? So it's very important aspect to learn, death certificate. Since we have completed the mortality, before coming on morbidity, I will come on morbidity also, the measurements of morbidity. Mortality is done. I will come on morbidity now. But before that, we will see international death certificate. So mortality ka basis is death certificate. We consider a person dead if the death certificate is issued by the doctor. Okay, so we rely on the doctor who is issuing the death certificate. First, the doctor verifies that the person is dead. Okay, and the doctor will issue the death certificate. Okay, now for national and international comparison, WHO has recommended international death certificate. It's uniform. Whether you are practicing in India, in US, in any country, anywhere in the world, death certificate is same. Death certificate doesn't differ from country to country. It is international death certificate. It is international death certificate. It is same everywhere. It don't differ from country to country, place to place. It don't depend on geographical area you practice. Okay, so for comparability, WHO have given the guidelines for the death certificate. So you should know how many lines it have. Death certificate, apart from the diseased identity, its name, age, address, and all other things, but for what it was admitted to the hospital, what was the hospital stay, what is the time of the death, you have to fill all these things. Okay, apart from that, in the death certificate you have to fill 4 lines. How many lines? 4 lines. You have to fill 4 lines in the death certificate. What are the 4 lines in the death certificate? There are actually 2 lines, line 1 and line 2. Can you see? This is line 1, this is line 2. Line 1 have further 4 lines, 1A, 1B, 1C, 1D. Line 2 don't have ABCD. So basically these are the 4 lines. So you have to fill 1A, you have to fill 1B, 1C is compulsory, but 1D is not compulsory. 1D, if it is applicable, you have to fill it. If it is not applicable, you can leave it blank. But 1A, 1B, 1C is compulsory and line 2 is compulsory. So being a doctor, being a medico, you should know what you have to fill on these lines. You can't write down anything random. Okay, you should write the relevant cause of death. So what cause of death you have to write down where? On these lines. What you have to write down on line 1A? What you have to write down on the line 1B? What you have to write down line 1C? 1D if applicable. Otherwise you can leave it blank also. But these 3 compulsory you have to fill. And what you have to write down on the line 2? You have to decide that. Yes or no? So 1A, we will write the disease or condition which directly lead to death on that moment. Suppose person dead right now. I'm a doctor, I'm working in an ICU, I'm on emergency duty, and there is one death occurred. Instead of trying hard, we couldn't save that life. Okay, and the person is dead. So what is the acute cause of death? Right now, what was the problem because of which the person is dead? Directly leading to death. That we have to write down on 1A. But this problem is due to what? That is 1B. But this problem is due to what? That is 1C. And this what due to what? That is 1D. So the antecedent cause you have to write down on the next lines. With the help of example, you will have a better understanding. Okay, this is a real death certificate. It is like this. You have to fill the lines 1A, 1B, 1C like this. And let me take an example. For example, in an ICU, I'm working in an emergency duty and there is the person who is dead. Instead of trying hard, we couldn't save the person and person is dead. So acute cause of death was renal failure, bilateral renal failure, acute bilateral renal failure, because of which the person was dead, unfortunately. Okay, so on 1A, I will write down renal failure. But why the kidneys were failed? You should think, why? Why? Kidney cannot fail as it is. There should be some underlying pathology that is causing the renal failure, bilateral renal failure, acute renal failure. Okay, that is causing the derangements and the person is dying. So the person was having diabetic nephropathy. In both the kidneys, the person was having diabetic nephropathy. The kidneys were nephropathy. You know, in pathology, you must know what is diabetic nephropathy. I taught you in pathology very well. So person was having diabetic nephropathy because of which the renal failure took place. Renal failure cannot be it is acute, but it cannot be directly. Now, there should be some underlying pathology. So underlying pathology is diabetic nephropathy. But why the diabetic nephropathy have occurred? Because person was having diabetes since last 20, 30 years and person was not on proper management. Instead of constant providing medications and insulin, person was not taking it regularly. Person was not taking medicines. Either the person was not aware or person was neglecting it due to any cause, due to poor condition or due to lack of knowledge, but person was not taking adequate treatment. And that's why, because of uncontrolled diabetes, person have diabetic nephropathy. Okay, so that is the underlying cause. Okay, so here 1D don't have any relevance. We can leave it blank. We can leave it empty. And apart from that, on line 2, you have to write down other diseases the person is having, but that is not related to death. The person is having some other diseases also, but that is not related to currently the cause of death. Okay, so this person apart from diabetes was having hypertension also, but the cause of death is not hypertension. So whatever other diseases person is having, you should enumerate it on line 2. So that is the thing. I hope you got it. I hope. So diabetes leads to diabetic nephropathy. Diabetic nephropathy leads to bilateral renal failure. And due to bilateral renal failure, person is dead at this instant. Got my point? So this is example 1. I hope you got it. Coming on one more example for better understanding. Suppose, again, in an ICU, we are working on emergency duty, one more death occurred. Okay. So what is the cause of this death? Currently, the cause of this death is intraperitoneal hemorrhage. Suddenly bleeding took place. Intraperitoneal hemorrhage, person go in shock, hemorrhagic shock and died. Instead of constant efforts of saving the person, we couldn't save. Okay, so the cause of death is intraperitoneal hemorrhage. But why does bleeding occur? There should be some underlying pathology. No, why bleeding cannot occur as it is? So there should be some underlying pathology. So intraperitoneal hemorrhage is due to ruptured metastatic deposits in the liver. In the liver of this person, the metastatic deposits were ruptured suddenly, and that took so much massive bleeding, and the person goes in shock and died. Okay, so the cause of this is ruptured metastatic deposit. But why the metastatic deposits were there in the liver? They ruptured, I got it. But why what is the primary? The primary, why they ruptured? Because there is metastatic deposits in the liver, and here they ruptured, but they were present in the liver, and the primary was in colon. The person was having colon carcinoma. Okay, maybe the person is on treatment or not on treatment, and from colon carcinoma, the metastasis took place in liver. They ruptured, they took the bleeding, they caused the bleeding, and because of bleeding, the person is dead. Apart from that, person have hypertension also, that is on line 2, but that is not the cause of death right now. Okay, so this is how you have to fill the death certificate. I hope you got it. So what you have to fill on the 4 lines, that is important. Okay, what you have to fill on line 1A, the acute condition, the direct condition that is leading to the death. On 1B, the antecedent cause. On 1C, again antecedent cause. And on 2, the other conditions which is not directly related to death right now. Okay, I hope you got it. 1D can be present, can be absent. If applicable, you can write down. Now in the 4 lines, which is the most important line? You tell me which is the most important line. Out of the 4 lines, the most important line is 1C or 1D. If 1D is applicable, go with 1D. If 1D is empty, go with 1C. That is the most important line. And this line is known as Ascent of death certificate because it is showing the main disease which is causing the death. For example, in this example, again see the 2 example. In this example, diabetes was the main disease. Because of diabetes, person was having diabetic nephropathy. And because of diabetic nephropathy, the person was having renal failure. And that's why the person is dying. So antecedent cause is shown over 1C. That's why 1C is the Ascent of death certificate. You can see the Ascent of death certificate. Similarly, in this example also, the main disease was colon carcinoma. This person was having carcinoma colon. That is causing mets in the liver. That got ruptured. That caused bleeding. That caused death. Okay, but the main disease was in carcinoma colon. So here 1D become the line of Ascent. The line of Ascent. So line of Ascent can be 1C or 1D. I hope it's done. Yes or no? Any doubts? Can we go ahead? Is it good to go? Okay. So I'm having a question for you. Read the question, tell me the answer. In WHO recommended death certificate, main underlying cause of death is recorded on which line? I mean, I want to ask the line of Ascent. The main underlying cause is recorded on which line? 1A, 1B, 1C or line 2? 1D option is not given to confuse you. So what is the correct answer? Absolutely right. The correct answer is C, and Bogala is first to answer. Very good, very good. The correct answer is 1C, line 1C, the Ascent. If 1D is also given, go with 1D. Okay, 1C or 1D both can be the line of Ascent. Okay, we are done with measurements of mortality. These were measurements of mortality. We are done with measurements of mortality. Now we will come on measurements of morbidity. Okay, can I come on measurements of morbidity? Let's revise what is morbidity. I already taught you what is morbidity. What is morbidity? Illness, sickness, disease. Any departure from the state of physiological well-being. Any departure. Maybe subjective, maybe objective. Subjective means the person is feeling. Actually, person don't have fever. But when the person is measuring, person don't have fever. But person is feeling like. Okay, that is subjective. And objective means we can measure it. We can measure the disease. So maybe subjective, maybe objective, but departure from health is morbidity. So how to measure morbidity? We are done how to measure with mortality. We know the simplest measure, we know the best measure, we know what measures burden of disease, okay, which is best for comparison and all the things we know. These are the measurements of mortality. And now we have to measure morbidity. Morbidity have only two measures, incidence and prevalence. So can we start? Are you people with me? So the measures of morbidity are only two. Incidence and prevalence. Prevalence is further of two types, point prevalence and period prevalence. One is period. Point prevalence and period prevalence. They are of two types. Okay, but there are two basic criteria that measures morbidity of a disease: incidence and prevalence. How many of you got it? You have to give me 1 minute. I want to drink water. Okay, and I will continue with this. It will take another 15-20 minutes, but we will finish this portion. Okay, give me a minute. Can we continue? Hi, people there? Sure. So we will continue with measurements of morbidity. There are two measures of morbidity: incidence and prevalence. We will take them one by one. What is the difference between incidence and prevalence? How to measure the morbidity? For morbidity, you have to say some disease. I want to measure morbidity of TB. Okay, where? In India. Okay, I take all the examples in India only. Okay, I want to measure the morbidity of TB in India. When? The year which is already passed, that is 2024. In entire 2024, what is the morbidity of TB in India in 2024? What is the morbidity? How to measure it? You have two ways to measure. You have two ways. You can measure the incidence of TB. You have to measure the prevalence of TB. What's the difference between the two? The incidence is the new cases in that year. It is the new cases in that year. You are getting my point? New cases. See. This is 2022. This is 2023. This is 2024. 25 is going on. I'm not writing that. Okay. So you can see this is the entire year. 1st January till 31st December. This is 1st January till 31st December. This is 1st January till 31st December. Like that. Okay. Now I want to measure the morbidity of TB in 2024. Can you see where is 2024? This one. I want to measure the morbidity of TB in India in 2024. Okay. Now there are two possibilities. There can be cases which diagnose TB in 2024 only. Okay, these are the new cases. These are the new cases of TB which diagnosed in this year only, after 1st January, before 31st December. Any of the month, maybe February, March, April, May, June, anywhere. So these are the new cases which are diagnosed in this case. Or the second probability, there can be cases of TB which are diagnosed in the past and they are not yet treated. They are continuing in 2024. Okay, these are the old cases. Okay, but they also have the TB. They are also here. They are also here. The old cases, I am drawing the lines. The new cases, I am drawing the dots. So basically, I am focusing in 2024. So in 2024, I am having two type of patients of TB over here. I am having some dots. I am having some lines. The dots are the new cases which are diagnosed in this year only. And the lines are the old cases which are diagnosed in the past. They are not yet treated. They are continuing to have TB here. Okay, you are getting my point. So if I take only dots meaning new cases. If I take only new cases, it's incidence. Incidence mein we measure only new cases. The denominator is total population. Okay, you can take midyear population of India. You can take total population at risk. You will say, ma'am, what is at risk? Why you have not written midyear population? From midyear population, many of the people have immunized for a disease, for a particular disease. For TB, we have the BCG. The people who have BCG, they have less chances of having TB. So we will eliminate that population. So from midyear population, if I remove the immune population, so the remaining population is population at risk. So ideally, we should not take midyear population. We are getting my point. We should say population at risk. But if it's creating confusion in your mind, कि मैम क्या बोल रही हो समझ में नहीं आ रहा, you can write down midyear population. For the ease of understanding, it's okay. It is not creating any much difference. You can write down midyear population. But I have explained you why I have not written midyear population. Because midyear population is complete, not population which can have TB. Out of the complete population, we have to eliminate the population which is already immune. The remaining population, that is population at risk, we have to take the denominator ideally. But if it's creating confusion, it's okay. You can take population at midyear population also. So that is the denominator. In the numerator, we will take only new cases. We will take only new cases which are diagnosed in this year. Okay, not they are coming from the past. Only new cases. That is the incidence. How many of you got it? What is incidence? Any doubt? Any doubt? I will come on the relationship one by one. No? I'll be prepared. I will come on that. Wait. You got the incidence? So out of the total population, okay, out of the population at risk, total population or population at risk, you can see two types of people, the blue and the green. The blue people are the ones who are diagnosed in 2024 only. And the green are the people who are diagnosed in 22, 21, 20. They are still continuing in 2024. You're getting my point? So I will take only blue one. That is the new cases. Okay, new cases we will take here. So you tell me looking at the formula. And what is the multiplier? I forgot to tell the multiplier. It's 1000. It's 1000. So the new cases are from population only. They are not aliens. From Indian population, midyear population, population at risk. These are the new cases. I mean, numerator is a part of denominator. And multiplier is 1000. Okay, and its time specifier is also there. So it's the rate. Incidence is the rate. Incidence is the rate because numerator is the part of denominator and multiplier is 1000. And time specifier is also there. That is 1 year. 2024 I consider always. Yes or no? Time specifier is also there. And we calculate incidence and cohort study. I will teach you case control and cohort study also. You will understand it better. But for now, you learn it is calculated in cohort study, not case control study. It is calculated in cohort study. How to calculate it, I will tell you. I will tell you. Wait a while. At that time, you will remember this also. I will remind you this. Okay, so this is incidence. Okay, what are the uses of incidence? It is used to control a disease. If you want to control any disease, you have to see its incidence. How many new cases are arising? Then only you can control it. To control the disease and for research purpose, to understand the etiology and pathogenesis of the disease, you have to see the incidence, the new cases. If you see the new cases, then only you can control it. That is the uses. Okay, now coming on prevalence. In prevalence, we take total cases, old and new both. Old and new both. I told you, no, this is 2024. This is 2024. Okay, 1st January, 31st December. First day of the year, last day of the year. Okay, all the 12 months are over here. Okay, how many cases of TB are there? There are two types of patients. Some who are diagnosed over here only. These are new cases. These are new cases. These are diagnosed here only in 2024. Some are old patient. Old, I mean they are diagnosed in 2023, 22, 21, 20, but they are not yet treated. They are continuing to have the disease. So these are the old. If I take only new, that is incidence. If I take all, not only old, I take old plus new, all, that is prevalence. Prevalence include all the current cases in that particular year. That is old as well as new. If I consider old and new both, that is prevalence. So prevalence means the denominator is same. The denominator is the total population at risk. I mean midyear population or total population at risk. The numerator include total cases. That is new and old both. It includes new and old both. It is not only new. So what, and the multiplier is 100. Mind it. Multiplier is 100, not 1000. So it's a proportion. It's a proportion. It's not an incidence. It's a proportion. And it is calculated in cross-sectional study. It is calculated in cross-sectional study. Let me tell you. Listen here. Listen. Incidence, prevalence. Okay. Incidence, prevalence. What is the numerator, denominator, and the multiplier? Who will tell me? Denominator, population at risk. Here also population at risk. Numerator only new cases. Here numerator new plus old. That is total current cases. Here new cases, here new plus old. That is current cases. Mind the multiplier. Mind it. People mind it. If I'm saying mind it, you have to mind it. So here multiplier is 1000 and here multiplier is 100. You are getting my point? Yes. So this one is a rate and this one is a proportion. Because here multiplier is 1000, here multiplier is 100. Here numerator is a part of denominator, here also numerator is a part of denominator. I hope you got it. If you are attending my session from the beginning, you are getting it. This one is calculated in cohort study. I will explain later on. This one is calculated in cross-sectional study. I will explain later on when I will explain you the studies. How many of you got it? Everyone give me a thumbs up in the comment box. Each and everyone who is live and understanding, not sleeping, kindly give a thumbs up in the comment box. Everyone. Got it? Yes. Can we go ahead? Huh? Can we go ahead? Yes. So that is the prevalence. Prevalence is of two types, point and period. You will understand. Okay. And prevalence is used for administrative and planning purpose. Suppose I'm a businessman. I'm not a doctor. I'm a businessman. And I'm having money and I want to open a hospital for the doctors to work. Okay. I'm a businessman. I want to open a hospital in a particular geographical area. I'm having a land in some area and I want to construct the hospital. So I want to construct TB hospital in which only TB patients will get admission. Okay. So I should use what? How many bedded hospital should I consider over here? It depends on incidence or prevalence. I mean, I will give admission to only new cases or all cases. Huh? In a hospital, we give admission only to new cases, or we give admission to new and old. Obviously, we give admission to all patients. Why we will reject the old patient? If an old patient want to get admitted, of course, if it require admission, we will get admitted. So for administrative purpose, for planning purpose, in a hospital, how many bedded hospital, what should be the staff, how many doctors we should appoint, like that. All this planning depends on prevalence. The planning don't depends on incidence. For incidence ka uses, what were the uses of incidence? To control a disease. To control disease, we need incidence. And for planning and administrative purpose, for hospital beds, for doctors, for nurses, for manpower, we need prevalence because we give admission to both. You understand this? Okay. So that is the uses of prevalence. So how to learn that? There is a mnemonic to learn. The mnemonic is incidence contain "and" in the spelling, and money new, and money new cases, and prevalence contain all in the spelling. See the spelling of prevalence. So it includes all cases, old as well as new. So it's a better way to learn, I guess. If you have some confusion, you can learn with the help of the mnemonic. Can we go ahead? Can we go ahead? We are done with incidence and prevalence. Now in the book Park, you know, you must be knowing Park. It's a standard textbook for the community medicine. This diagram is given. This diagram I have not created, but it's a very good diagram I got from there. Now in this diagram, what you can see? Whatever you can see, you just describe in your own language. Huh? Please describe. I can see a tap. मुझे एक नल दिख रहा है, tap, from which water is flowing, and I can see a bucket. The bucket is having an exit. I can see a bucket or a drum, okay, in which there is an exit. The water is coming, filling in that, and getting exited from there. This is what I can see. Okay, I don't know anything, but I have described the image in my own language. Whatever I can see, I can interpret, I can say it. Okay, so I have seen that. Now, can you say what is incidence and prevalence in this diagram? Incidence is the new water and prevalence is the total water. Okay, so the new water which is entering over here. Can you see the new water? The new water, this is new. The new water which is entering, this is incidence. Okay, after going in the bucket, it is mixing with the old. So the bucket have new plus old both. The bucket have both, na? New plus old. So bucket ka water is prevalence. So the water which is falling from the tap is incidence. And the water in the bucket is prevalence. So what does the prevalence means? The prevalence is the new and old both cases. Okay, I mean they are cases. They have some disease, either new disease or old disease, but they have the disease. How to exit from the disease? Okay, if the person is lucky, person recover. Or if the person is unlucky, person dies, dead. So there are two ways to exit. Suppose I'm sick, I'm ill, I'm having some disease. Suppose I'm having TB or any disease, XYZ, unfortunately, suppose, okay, I'm having some disease. So I want to come out of that disease. There are only two ways. Either I get cured, recover, very good, or I can die. Okay, then only I can exit from the disease. So exit point is two. Either the person recover or the person die. Okay, so fill in the blanks. You can see three fill in the blanks. So what is the new water? Say incidence. What is the total water? New plus old? Say prevalence. And what is the exit of the prevalence? The exit of the prevalence is recovery of death. So you can get these fill in the blanks in this beautiful diagram and you can have a better understanding. The new cases is incidence, the total cases is prevalence, and the exit of the prevalence is recovery of death. How many of you got it, people? Are you getting it? Can we go ahead? Huh? You got it? Okay, so this is the diagram. So what we have learned till now, we have learned incidence is the rate, okay, and prevalence is the proportion. Here the multiplier is 1000, here the multiplier is 100. It is calculated in cohort study, it is calculated longitudinal cross-section study. What are these studies? I will explain you later on. Okay, got it. So how to calculate? Now you tell me. Now you tell me. How to calculate the morbidity of TB in 2024 in India? Can you see India? Beautiful India. Huh? Can you tell me how to calculate the morbidity of TB in 2024 in India? Say, ma'am, I'm having two ways. I can calculate incidence, I can calculate prevalence. Okay, so if you are taking only new cases, okay, it will be incidence. And if you are taking new and old both cases, it will be prevalence. Okay, the denominator of both of them is same. Okay, that is population at risk. Multiplier is different. I hope you got it. We are having one more example, a great example for you. You're getting it? Give me some emojis. Come on, give me some thumbs up. Show some reaction that you are live. Okay, it is not a recorded version. People, you are watching me live. Okay, I can see your reactions. Thank you. Thank you so much. Thank you. Come on. We will solve this. Let's see who got it. Let's see who got it. Chalo, everyone have a look over here. Understand what I'm asking. I'm having 4 questions for you. 4 questions, 4 answers. Everyone on the screen, first you understand my question before jumping on the answer. Don't try to mug up. Don't try to jump. Have a look over here. First understand what I'm asking to you. First understand it. Can you see 2 lines? Can you see 2 vertical lines over here? So this is 1st January. I'm talking about 2024. In entire PSM for the next 4 months, I will be talking about 2024 that is already past. Okay. In 2024, remember the first day of the year? 1st January. Remember the 31st December when we all party, New Year party, 31st December. This is that day. So this is 31st December, you can see, and this is 1st January. This is start of the year, this is the end of the year. First you understand what we want to explain with this diagram. Okay, what is dot? Dot is the start of disease. We are talking about TB again. Okay, TB. So this is a case which is diagnosed with TB before 1st January 2024. I mean in 2023 or anywhere before that, the person is diagnosed. The person is continued to have TB in the entire year of 2024 and person still continue in 2025. In 2025, this is the end point. End point can be 2. The person recover or person die. I don't know. Whether this person recovered, die, I don't know. But this is the end point of the disease. So this is the meaning of what. Now, for example, this is case 1. This is the story of case 1. Coming on the story of case 2, this is the start point, which is before 2024. Okay, and but in 2024 only, the person get cured, either cured or death in January, February only. You can see at the start of the year only. Same see case 3, what happened, the story. Case 4 ka story started here and ended here in this year only. Case 5, case 6. Case 6 started in 2025, not in 24. Case 7, case 8. You see the story of all 8 cases. When they started, when they continued, and when they ended. The end point can be recovery, can be death. I don't know. Okay, but it can be recovery, it can be death. I know that. So see the start point, see the end point of all 8 cases. There is a story of 8 cases written in front of you. Now, can I ask the question? I'm having 4 questions for you. You understood this diagram? The 4 questions. Now, I will minimize this diagram and ask the 4 questions below. See the 4 questions. Now, looking at this diagram, can you tell me the incidence of TB in this particular 2024 year? Can you tell me the point prevalence on 1st January? Can you tell me the point prevalence on 31st December? And can you tell me the period prevalence from 1st January to 31st December? 4 questions, 4 answers. Answer them one by one. First, answer incidence. What is incidence? Incidence means new cases. Only new cases. So tell me the cases which are diagnosed after 1st January and before 31st December. The new cases. See the dots, the new cases. You are getting my point. Case 1 is diagnosed before. 2 is also diagnosed before. But 3 is a new case which is diagnosed in the CF. 4 is a new case. 5 is a new case. 6 is diagnosed after this year. I will not take it. 7, again, I will not take it. 8, I will take it. So I will take 3, 4, 5, and 8. 3, 4, 5, and 8. They are diagnosed in this year. The new cases. Okay, the remaining are either before that or after that. They are not new cases in this particular year. You are getting it? Yes, 3, 4, 5, 8. Absolutely right. Many of you are right. I hope you got it. Okay. Now, second question. Second question, tell me the point prevalence on 1st Jan. Where is 1st Jan? 1st Jan, the first day of the year. 1st January. This is 1st Jan. Can you see? This is 1st Jan. On the 1st Jan, tell me all cases. Prevalence. Prevalence माने all cases. Whether old, whether new, कुछ दिमाग नहीं लगाना. All cases. All cases. I can see four cases. Case 1, case 2, case 7. I can see 3 cases. 1, 2, and 7. Which is crossing this line. to 1, 2, and 7 is my answer. Okay, 1, 2, and 7. Now tell me the point prevalence on 31st December. How many cases cross this line? Whether new, whether old, don't think. All cases, all cases. I can see case 1, case 3, case 5, and case 8. So 1, 3, 5, 8. I hope you are getting it. So how many lines are crossing this line? 31st December. And last question, tell me total period prevalence from 1st January till 31st December. Tell me all new as well as old cases. New as well as old cases from this to this. All period prevalence. It is not point prevalence. So all the cases will come except 6. 6 is not coming in this duration. 6 is coming after that. And remaining all are coming. Either they are new or old. So I will say 1, 2, 3, 4, 5, 7, and 8. Not 6. I hope you got it. I hope you got it. So 4 questions and 4 answers. If you didn't got it, you can recap this portion later on and understand it. I hope you got it. Okay. So this is the best example I can give you to understand incidence and prevalence. So we are done with incidence and prevalence. What is incidence? It's the rate because multiplier is 1000. What is prevalence? It's the proportion because multiplier is 100. Here we take only new cases. Here we take new and old both cases. Okay, this one is calculated in cohort study. This one is calculated in cross-section study. Tell me the uses. This one is used for control of a disease. This one is used for administrative and planning purpose of opening a new hospital, how many bedded hospital like that. So that is the incidence and prevalence. Now, the last thing over here is relationship between incidence and prevalence. We understood what is incidence. We understood what is prevalence. Now tell me the relationship between them. Prevalence is equal to incidence into duration. Prevalence is equal to incidence into duration. Please learn this by heart. Please learn this formula. Prevalence is equal to incidence into duration. Please learn this formula. Okay, duration of the disease. Okay, so please learn this formula. If you have understood, how many of you learned this formula? If you have learned this formula, I will ask questions. I will ask 3 questions. 3 questions, 3 answers. But all of them are tricky questions. 3 questions, 3 answers. Who have understood? Everyone have understood. Are you ready? Okay, my first question. Based on which? My first question. There are 3 questions. One by one we will discuss. Please learn this formula. The formula is very simple. Okay, what's the formula? Prevalence is equal to incidence into duration of the disease. This is the formula. I guess everyone knows the formula. It's a very small, little formula. I mean, very easy formula. But 3 questions are tricky. My first question. What is the effect of duration of disease on prevalence? Okay, what is the effect of treatment of a disease on the prevalence? And what is the effect of vaccine for a new disease? We have a new vaccine discovered on the prevalence. You have 3 options. Prevalence in each of them will increase or decrease or constant. You have 3 options. One by one we will take. So my first question, what is the effect of duration of a disease on the prevalence? You see the formula. It's very simple. Who will answer it? Whether the prevalence will increase or decrease or remain same. You have 3 options. Prevalence will increase, prevalence will decrease or remain same with the duration. Look at the formula now. Say ma'am, if duration of the disease is more, prevalence will be more. If duration of the disease will be less, prevalence will be less. Because prevalence is directly proportional to duration of the disease. I can see in the formula. Obviously, I can see in the formula. Prevalence is directly proportional to the duration of the disease. Obviously, yes. So since prevalence is directly proportional to duration of the disease, if I increase duration, prevalence will increase. If I decrease duration, prevalence will decrease. Very easy. Okay, this was easy. But please understand the catch over here. So if we are increasing the duration, for example, there is a disease which is TB. TB is having very high duration. You know, the minimum DOTS ka therapy is 6 months. Okay, and disease lasts for months, maybe some years also. So it is having a disease which is long duration. So since the duration of the disease is high, prevalence of TB in the community is also high. If you measure TB in India, how many people have TB in India? You will get a high prevalence. It is not new cases are more. New cases are not much, but the duration of all cases is more. Okay, that's why the prevalence of the disease is more. Got my point? So prevalence of the disease is more because the duration of the disease is more. Since the disease is having high duration, the prevalence is more because prevalence is directly proportional to duration. So that we have seen with high duration, prevalence is high. Now we will see with low duration. Now, which disease have low duration? If the duration is low, prevalence will be low because prevalence is directly proportional to the duration. Which disease have low duration? Low duration can be of 2 types. Either the people recovered or the people died. Okay, we always consider this. We don't consider this. In death also the duration is low. Okay, suppose a disease is a light disease, I mean very minor disease. Suppose runny nose, common cold, we all have it day to day, tonsillitis. Okay, we get cured in next 3, 4, 5, 6 days. Okay, so duration of disease is less. That's why prevalence is less. Okay, we have common cold for how many days? Maybe 7, 8 days, not more than that. So we have duration less. That is prevalence less. But have you imagined rabies? Rabies is the disease in which person dies very fast. Very fast. Okay, highly fatal disease. Person dies. Person dies. That is also happening less prevalence. Because here also the duration is less. So less duration can be of two causes. Either the disease recovered very fast, like the common cold, or the disease is very fatal, like the rabies. Both of them have less duration. This is having less duration because person is recovering very fast. Okay, and this is having less duration because the disease is very fatal. Diseases in both these situations, duration is less. Since the duration is less, prevalence is less. I don't know how many of you got it, but I tried from the depth of my heart. You got my point. So the duration of disease can be less in two situations. You always consider first, you don't consider the second. Okay, so either the disease is recovering very fast or the disease is very fatal. Okay, either the disease is curable, very fast curable, or it is fatal. In both of them, the duration is less. Since the duration is less, prevalence is less. I hope we are done with the duration. Okay, so coming on the next question. Next question is super tricky. The next question is super duper tricky. You tell me, what is the effect of treatment on prevalence? Look at the formula. Apply your common sense. What is the effect on treatment? If I'm treating a disease, whether the prevalence will increase or decrease. If I'm treating a disease, the prevalence will increase or decrease. What is your answer? Whether the prevalence will increase on treatment or whether the prevalence will decrease on treatment. I'm asking you people, kindly answer in the comment box, please. Decrease. Most of you are saying decrease. Sumana, Deep, Bogala, Palak, Anna, Pranitha, life begins. Yes, everyone is saying decrease, but the answer is both. Okay, I will explain how. Everyone is saying decrease, that's the common sense. So that proves you have the common sense. But once you understand the community medicine knowledge also, your answer will change. Okay, now most of you are thinking that on giving the treatment, why the duration will decrease? None of you told me the reason. You will say, ma'am, on giving the treatment, duration of the illness will be less. So suppose I'm having TB. Okay, suppose if I take the treatment, I will get cured in 6 months. But if I don't take the treatment, I can have TB for 3-4 years. Okay, so on taking treatment, duration decrease. Since the duration decrease, incidence will decrease. Prevalence will decrease. Treatment don't affect incidence. Incidence in a new case. वो तो हो गया ना? New case already done. I already have the TB. I'm already a new case. Okay, now if I take treatment, I don't take treatment, new case will not affect it. So it is not affecting incidence. Treatment affects duration of the disease. If I take treatment, my TB will cure fast. If I don't take treatment, duration of the disease will be long. So treatment affects duration. That's what most of the people think. Most of the people think, and this is how you people are right. This is how the one who are saying the prevalence will decrease. Most of you are right partially, not completely. Now, you know there are two types of diseases. How many of you know there are two types of diseases in the world? There are two types of diseases. Depending we are giving treatment to which disease. There are the disease which are curing, they get cured on treatment. And there are chronic diseases which on giving treatment they don't get cured. Okay, only we are prolonging the life of the person. For example, diabetes and hypertension. Does anyone have diabetic or hypertensive patient at your home? Maybe your parents, grandparents, maybe your relatives, neighbors, anyone. I guess we all have diabetes and hypertension are very common chronic illness we see around us. Our parents, grandparents, relatives, many of them have diabetes and hypertension. Once they have this disease, it's chronic. It's throughout the life till death. They have this disease. It is not curable. Diabetes once happen, it is not curable. Hypertension once happen, thyroid, hypothyroidism once happen, it is not curable. It is throughout, most of the time it is throughout the life. Diabetes, hypertension especially, they are throughout the life. Yes or no? So why we give the treatment? Why shall we give the treatment? You say, ma'am, if they are not cured, why we give treatment? We give treatment for hypertension. I will teach antihypertensive drugs in pharmacology. Why we give hypoglycemic drugs or insulin for treating diabetes? Why we give the treatment? It is not curing the disease, only to prolong the life. Only to prolong the life of the patient. We are prolonging the life and decreasing the complications of the disease. So basically, by giving treatment, I'm increasing the duration of the diseased people on this earth. I do not want these people to die. Okay, if I don't give them treatment, these disease will exaggerate, they will have complication, and the person will die with the complication of diabetes, complication of hypertension. I do not want that. I just want to prolong their life with the disease only. Okay, they will remain diseased throughout their life, but they don't have complication. On a maintenance therapy, they will survive throughout their life normally only. But I want to give the treatment to prolong the life of the diseased people on this earth. Okay, here I'm giving the treatment to cure them. Here I'm giving the treatment, okay, to prolong the life of diseased person on this earth. You are getting my point. Now take them one by one and tell me what is the effect of treatment on prevalence. So in a curing disease, if I am giving the treatment, basically it is reducing the duration of the disease. For example, if the person is having runny nose, okay, I'm giving antibiotic, person will get cured. I'm reducing the duration. Since the duration is less, prevalence is less, so I'm reducing the prevalence. In chronic disease, in curing disease, we are reducing the prevalence on giving treatment. But if the person is having diabetes, the person is having hypertension, they are not curable. Once they occur, they will be throughout their life. Okay, for a chronic non-curing disease, if we are giving treatment, basically we are increasing the duration of the disease on this earth. On this planet, we are increasing the lifespan, the duration of the diseased people on this earth. We are increasing their lifespan. We do not want them to die. Okay, so basically we are increasing the duration of the diseased people on the earth, and this is how we are increasing the prevalence. So what is the summary? So treatment can increase or decrease the prevalence depending in which disease we are giving the treatment. If we are giving the treatment in curing disease, it will reduce the prevalence. If we are giving the treatment in chronic non-curing disease, it will increase the prevalence. I don't know how many of you got it, but I tried, people, with the help of flowcharts and diagrams. Yes, got it. Curing disease, Amit. Curing disease means on giving treatment, they get cured. And non-curing chronic disease means on giving treatment, they don't get cured. Only we are prolonging the life of such persons by giving maintenance therapy, by reducing the complications. It was a tricky concept, people. Okay, very few students understand this. But how many of you understood? Give me a thumbs up. Give me a thumbs up. Give me an emoji of thumbs up. Or give me a thumbs up in the comment box. The one who understood. No one understood. Everyone. Yes, come on. If you didn't understood, ask me again. Everyone understood the concept. So what is the final summary? On giving treatment, we can increase the prevalence as well as reduce the prevalence, depending which disease we are giving the treatment. If we are giving treatment for a curing disease, it will reduce the prevalence. If we are giving the treatment in a chronic non-curing disease, it will increase the prevalence. That is the summary, and you must have an understanding why I am saying so. My last question. What is the effect of vaccine on the prevalence? What is vaccine or immunization? Are you vaccinated? Are you vaccinated for OPV, IPV, DPT, BCG, flu vaccine? Many vaccines, MMR vaccine. Ask your mommy, ask your mother. Your mother or your parents may have immunized you when you were a kid. I guess everyone is vaccinated or immunized. 100% immunization. Yes or no? I guess. So why we are immunized? What is vaccine? What is immunization? It prevents the diseases which have not yet occurred. Okay, it's a prevention. Vaccine is a prevention. You are getting my point. So it's a prevention, the diseases which have not yet occurred. So by giving vaccine, we are reducing the incidence of a disease. So if I'm vaccinated for BCG, I will not have TB. If I'm vaccinated with OPV, IPV, I will not have polio. If I'm vaccinated for DPT, I will not have diphtheria, tetanus, okay, and pertussis. I will not have these diseases. So new cases will reduce. Okay, duration will not reduce. It don't affect duration. Vaccine don't affect duration. Vaccine affect incidence. If we are giving vaccine to a child, we are reducing the new cases to happen. So it reduces the incidence, so it reduces the prevalence. Because prevalence is directly proportional to incidence. I hope you got it. Yes or no? So if we are giving a new vaccine to a children, incidence will reduce. And since incidence will reduce, the prevalence will reduce. Prevalence depends on two things. Prevalence depends on incidence and duration. Okay, so some things affect duration, something affects incidence, and finally it affects the prevalence like that. How many of you got it? Prevalence is directly proportional to both of them. Prevalence is directly proportional to incidence. Prevalence is directly proportional to the duration. I hope you are getting it. So 3 questions, 3 answers. The summary. Who will tell me? Who will tell me the summary? 3 questions, 3 answers based on the formula. Formula is in front of you. Everyone. Formula is in front of you. People say, be interactive. Come on. Chalo, bolo. 3 questions, 3 answers. The formula is in front of you. Tell me the effect of duration of disease on the prevalence. Tell me the effect of treatment on the prevalence. And tell me the effect of vaccine on the prevalence. Duration of illness. The disease with long duration will increase the prevalence. The disease with short duration will decrease the prevalence. Very easy. But short duration disease is of two types. The disease with fast recovery and the disease which are fatal. Both of them are of short duration, and that's why both of them have less prevalence. Okay, that is a summary of duration of disease. Now coming on treatment. Treatment can increase the prevalence as well as reduce the prevalence. Okay, the disease, if we are giving the treatment for curable disease, it will reduce the prevalence. If we are giving the treatment for chronic non-curable disease, it will increase the prevalence. So answer is both. And a vaccine will always reduce the prevalence, because vaccine reduces the incidence, and incidence is directly proportional to prevalence. That is the summary. I tried hard. Okay, got it, everyone. Okay, so this is the summary. You know what is incidence? It is the new cases. Okay, you know what is prevalence? It is total cases, old plus new. And this is the relationship between them. Based on the relation, I told you 3 important questions which are frequently asked in your exam. Very frequent, patent questions. Okay, let me show you some examples over here. Are you people ready? How many of you are ready? Can I throw the first question? The first question is in front of you. Read the question, tell me the answer. Let me read it for you. Following is true about prevalence and incidence. Which of the following statement is true? Both are rate? I don't think so. Huh? Prevalence is the rate, but incidence is not. Is it? Or incidence is rate, prevalence is not. Or both are not rate. What is the correct answer? You people are too slow. Huh? Deep is first to answer. Very correct. So we know incidence is the rate, but prevalence is the proportion. So correct answer is C. You all are right. Now everyone is right. Okay. So incidence is the rate and prevalence is the proportion. You can see incidence is the rate, prevalence is the proportion. Here the multiplier is 1000. Here the multiplier is 100. Okay. Got it? In both of them, numerator is a part of denominator. The next question, very tricky question. Very tricky question. A drug which reduces mortality. A drug means treatment. We are giving treatment to a patient for a disease that is reducing the mortality. Okay, I mean increasing the lifespan of the patient, but not curing the disease. The disease is not cured. For example, diabetes, hypertension. We give treatment. We give the drugs. We give the drugs to treat the hypertension and diabetes. They reduce the mortality. Okay, but they don't cure hypertension. They don't cure diabetes. There is no drug yet discovered which cure these diseases. We only decrease their mortality. So what basically we are doing? By giving such treatment. You know the formula. Incidence is equal to prevalence into duration. Now see the core options. What is the effect on incidence and prevalence by giving such a treatment? By giving such a treatment, we are increasing the lifespan of the diseased people on this earth. Because these people are not dying. They are surviving on the treatment for longer as compared if we don't give them treatment. So we are increasing the duration of the disease and we are increasing the prevalence. There is no effect on incidence. Treatment don't affect incidence. Once I have TB, I have TB. On taking treatment, it will not affect my case. I'm a new case. Okay. So incidence is same, but prevalence increases. So correct answer is D. And few of you are right. Not everyone, but yeah, many of you are right. Yes, correct. The correct answer here is D. I hope you got it. It was a tricky question, real tricky. If you want to understand, if you want to mug up, it's okay, you can mug up. But if you want to understand in depth, this was the meaning. I hope you got it. Okay. Now next question is a numerical. You can solve it in your notebook. Chalo. So what is given here? Calculate the prevalence. You have to calculate the prevalence. Incidence is 2 cases per 1000. Okay. Incidence is 2 cases. So incidence is 2 cases per 1000 per year, and duration of the disease is 4 years. So what is the formula? If you know the formula, you can do the calculation. It's very easy. Prevalence is equal to incidence into duration. So 2 into 4. It is 8. 8 cases per 1000 per year, because it is per 1000 per year. So I guess the correct answer is 8 cases per 1000 per year. Per 1000 per year. The correct answer is A. It was a very easy numerical. You don't even have to touch your pen to solve this. Yes or no? Next question. Next question, you have to solve it. Chalo. So in a population of 5000, so total population is 5000. Okay, I will say midyear population or population at risk. Total population is 5000. Number of new cases is 500, and number of new cases is 500 and old cases is 150. So new cases is 500 and old cases is 150. What is the prevalence? They are asking the prevalence. What is the formula of prevalence? You tell me. So prevalence is the total cases. I mean old plus new. Total current cases. Old plus new. Upon total population at risk. Okay, they have given one population. We will consider that population at risk. But what is the multiplier? Is it 1000 or 100? People, is it 1000 or 100? It's 100. Use the correct multiplier. So add the two, 500 plus 150, it will be 650 upon 5000 into 100. You please do the calculations for me. You please do the calculation for me. So this is, I'm not interested in mathematics class. I'm just interested in the concept. If you do the calculation, the correct answer will be 13%. You can do this calculation for me. The same calculation I have told you. Okay, so you can do this rough calculation and this is how the answer will be there. So we are done with the, what I taught you today. I taught you the measurements of mortality. I told you 6 measures. Yes or no? And measurements of morbidity. I told you 2 measures, incidence and prevalence. And I told you a relationship between them. And here I told you the death certificate, international death certificate. So that was a summary, what I taught you today. Okay, and after that, the next topic we are starting is epidemiological study. Since it is a big topic, so I will start tomorrow only. Okay, so that it will be in continuation. But wait. I want to show you the glimpse what I am going to teach you tomorrow. So tomorrow I will teach you the observational study, experimental study. Here basically I will teach you case control and cohort. Okay, and here basically I will teach you randomized control trial. You can't dare to miss it, and it's a free class. Let me tell you when, time, venue, everything. Okay, wait for just next 2 minutes. After that you can go. Listen, so nobody must have taught you this studies in the way I'm going to teach you. It will be a super unique way. So I'll just show you a glimpse, okay, so that you can attend the tomorrow's class. I will teach you case control and cohort study. Okay, I will teach you RCT. So I will take a hypothesis. What is my hypothesis? My hypothesis is smoking leads to lung cancer. I will prove that tomorrow, in detail tomorrow. Today I am just showing you the glimpse. Smoking leads to lung cancer. Say, ma'am, it's already proven. You are not proving it first time. There are thousands of studies which have proven this. I know. But suppose I am an epidemiologist. And today, first time, I am going to prove that smoking leads to lung cancer. I will prove that with the help of case control study and cohort study. So how I will prove that? Before I start the case control and cohort study, I will teach you certain terminologies in detail tomorrow. What is the case? Case is the person who has the lung cancer, already proven lung cancer. What's the control? Control is a healthy person who don't have lung cancer. So first you understand what is case, what is cancer. Okay, I will use these terminologies tomorrow. Okay, I will use these 2 terminologies, exposed and not exposed. Exposed is a person who is exposed to smoking, who is exposed to the risk factor. The risk factor here is smoking. The person is a smoker from years. He is smoking constantly. And this person do not smoke yet date. Not smoke yet date. This is not exposed. So I will use the word case, control. What is case? What is control? What is exposed? What is not exposed? You understood these 4 things. What is the case? What is control? Here disease present. Here disease absent. Okay. What is exposed? Not exposed? Here risk factor present. That is smoking. And here risk factor absent. That is smoking. So here disease present, disease absent. Here risk factor present, absent. Now it becomes super duper easy. I will tell you the details tomorrow, but have a glimpse. This is case control study. So from the population, I will take 100 cases, 100 control. Okay, from this 100, I will ask the question, how many of you are smoker, how many of you are not smoker? And from these 100 control, I will ask the question, how many of you are smoker, how many of you are not smoker? From 100 cases and 100 control, I will ask the same question. I will divide them in 4 parts. So some of them are smoker, some of them are not smoker. Some of them are smoker, some of them are not smoker. And based on that, I will do the analytics tomorrow. I will teach you how to calculate all the analytics here. Similarly, in control, from the population, I will take the exposed and not exposed. Here, I have taken 100 cases and 100 control. Here, I have taken 100 smoker and 100 not smoker. See the starting point. Here I have taken 100 cases and 100 smoker, and then see which smoke, which don't smoke, which smoke, which don't smoke. Here I have taken 100 smoker, 100 not smoker, and then following them down the line for 10 years, I will see which have lung cancer, which do not have lung cancer, which have lung cancer, which do not have lung cancer. It's opposite. So this is how I'm going to teach you tomorrow, and randomized control trial is super duper interesting. You can't afford missing tomorrow's session. Okay, this was the first session today, demo session. Today, we have the first one. We have 7 more. Note down the dates. If you want to take the snapshot, please take the snapshot of this. We are having 8 demo sessions, 2 of each subject of the third Prof, 2 of community medicine, 2 of forensic medicine, 2 of, but then we have 1 break day over here. Then we have 2 of ENT and 2 of ophthalmology. These all are free sessions. The first is done today. The second is tomorrow. Okay, tomorrow's session is also free session, but that is not on YouTube. That is on app. So that is on MedLive by Dr. Priyanka. You have to download this app, install this app, MedLive by Dr. Priyanka app, and it's absolutely free, like YouTube only. Now you may be thinking, ma'am, why not you are taking on YouTube? It's free only, no? You can take it on YouTube also if it's free like YouTube only. Because on the app, I'm having many features which is not available on the YouTube. I'm having a feature of poll. Here I'm launching the poll now. So in the poll, I mean in the MCQ, I cannot launch the poll. I mean, I have to see in the comment who's the first, who's the second, who's the third. But there I'm having a feature to launch the poll. Once you click the one of the four correct answer, automatically a leaderboard is generated. You will come to know, you will compete among yourself who is first, who is second, who is third. We are having many important features on our app, and you will have a very engaging lecture, maybe more engaging than today also. Tomorrow you will have a much better experience. Okay, so as compared to YouTube, on the app we are having many much features, and the session is absolutely free. So tomorrow I'm going to teach you case control, cohort, and experimental epidemiology. It's a very important topic, you can't afford to miss it. So you have to download the app. After downloading, installing the app, there are many courses. You have to go in this course. That is third year free demo course. It's a course available on the app. Don't go in the premium course. Go in the free demo course. Third year free demo course. And you will get tomorrow's session over there. The time is same. It's 6 p.m. So time is same. In the evening, 6 p.m. Epidemiology part 2. We are going to continue there. I request all of you and invite all of you to come there. The link to download the app is available in the comment section. It is pinned, already pinned. Who don't know from where to download it, please go in the comment section. There is a link given. Click on the link. Just install the app. Nothing you have to do. Install it, and after that you can attend the session tomorrow. Okay, that's it. That's it. One more thing, last thing, the people who were waiting for the demo, there were many students, hundreds of students told me they want to attend at least one demo. So this demo is over, and today midnight, 12, the offer is over. The pre-booking offer will be over. So those all students who want to grab pre-booking offer or who want to grab the existing using offer, only few hours left. At 12 midnight, the offer will be over. After that, normal prices will be there. If you want to have inquire any other query regarding the course, you can note down this number. On this number, calling is not available. WhatsApp is available. So please WhatsApp your query over there. The team will definitely guide you, or you will get a call back from the team. Thank you so much. I wish I could meet you again tomorrow at 6 p.m. Epidemiology episode 2 on app. MedLive by Dr. Priyanka app. It's a free session like YouTube only, but with more features. Okay. Okay then. Bye-bye. See you tomorrow on the app. And a day after tomorrow, we will meet again on the YouTube. A day after tomorrow with the FMT. Tomorrow is Sunday. Monday again we will. The time is wrong here. The time is 6 p.m. only. All the sessions are on 6 p.m. Okay. In forensic medicine, again, we will meet on YouTube. That is postmortem. The first session of all 4 subjects is on YouTube. The second session of all 4 subjects is on the app. And these all 8 sessions are free. I hope you got the concept. Okay. Any other query, you can WhatsApp. Thank you so much. Bye-bye. Good night. And thank you for giving your precious time. I hope this session was worth watching. Each and every minute was worth. Okay. I didn't waste it even a single second, single minute of yours. And I think the session was useful. Okay, chalo. Bye-bye. Good night. Best of luck. And see you tomorrow. Bye-bye. I'm ending the session.